I'll request the delegates to observe a moment of silence for prayer or meditation. Thank you very much. We will now proceed. Honorable delegates will now proceed. And I would like to remind all delegates of the following: that the virtual sitting constitutes a sitting of the National Council of Provinces, and the place of the sitting is deemed to be Cape Town, where the seat of the National Council of Provinces is. Delegates in the virtual sitting enjoy the same powers and privileges that apply in a sitting of the National Council of Provinces. For the purpose of the quorum, all delegates who are logged on to the virtual platform shall be considered present. Delegates must always switch on their videos, and delegates should ensure that the microphones of their gadgets are muted and must always remain muted. And please note that the interpretation facility is active. And any delegate who wishes to speak must use the raise your hand function or icon. And by now, honorable members are familiar with the raise your hand function or icon. I've also been told, honorable delegates, that there shall be no notices of motion or motions without notice, and this is in accordance with the Council Rule 2471. Honorable delegates, before we proceed to the questions, I would like to take this opportunity to welcome the Deputy Ministers of Health and Sports, Arts, and Culture. Furthermore, I would like to make the following remarks: that the time for reply by the Deputy Minister to a question is 5 minutes. That only 4 supplementary questions are allowed per question. A member who has asked the initial question would be the first to be afforded an opportunity to ask a supplementary question. The time for asking supplementary question is 2 minutes. And the time for reply to a supplementary question is 4 minutes. The supplementary question must emanate from the initial question asked. Honorable delegates, please note that the Deputy Minister will respond to a question on behalf of the Minister. I now call on the Honorable Deputy Minister of Health to respond to question number 77, asked by the Honorable A.D. Malika. I've also, of course, been informed that Honorable Nsube is standing in for Honorable Malika. So, Honorable Deputy Minister, please respond to the question.
Thank you very much, Honorable Chairperson of the National Council of Provinces. And thank you very much to Honorable Malika for the question. The reply is as follows. The National Health Insurance is South Africa's strategy of moving towards universal health coverage. Which means that when we reach that coverage, everyone, everywhere will be able to access health services without experiencing financial hardship. At the current moment, more than 84% of the South African population doesn't have a secure coverage. The 84% depend on the public health system, which, as we know, is very much stretched in terms of its resources. Our fight against COVID-19 has brought into sharp focus the downside of the current health system that is not underpinned by the principles of universal health coverage, as I've mentioned, where we want to go. It's not underpinned by social solidarity and equity. So the COVID-19 has exposed the disadvantages also of our current fragmented and inequitable health system. To address these challenges and through the stewardship and leadership of government during this pandemic, measures were put in place to integrate financing and provision of healthcare services in both the public and the private sector, in line with the principles of solidarity and equity. The interventions which were embarked upon included ensuring that the required health workforce is distributed equitably between provinces and between the public and private sectors, including primary healthcare practitioners such as general practitioners, nurse practitioners, and also provision of ICU, also including in the private hospitals. Laboratory services were also spread between the public and private sectors based on need. The private sector also ensured that the public health facilities are not deprived of oxygen supply, which was also under a lot of stress, to making sure that everybody can get access when they need the oxygen. Quarantine sites were provided by both the public and private sectors, ensuring that the population in need did not suffer hardships from accessing the quarantine services. The NHI will contribute to the general improvement of our health services in the country, in that it requires that facilities that are going to be accredited to provide services must comply with quality standard as prescribed by the Office of the Health Standard and Compliance. This has been demonstrated by the efforts put in place as we have been managing this pandemic. Amongst other things, making sure that we strengthen infrastructure in readiness for the NHI. This was accelerated during this period through revitalization of the existing infrastructure, completion of some of the outstanding facilities, such as an example, the Pixley Kaisakaseme Hospital in KwaZulu-Natal in the Inanda area, and the building of some new clinics and also hospitals throughout the country. We also strengthened infection prevention and control in our facilities as per our guidelines. We have established occupational health and safety committees in all facilities to protect the safety of health workers and patients and to improve quality of service. We have implemented stock visibility systems to mitigate against shortage of medicines and also shortage of PPEs. We have also the implementation of clinical care pathways, including the use of protocols and guidelines for the various levels of care. That is an essential component of ensuring the delivery of quality services as required under the needs. So the management of COVID-19, as highlighted, has indicated the importance of using clinical protocols and guidelines, and therefore has laid a very good foundation for the implementation of the National Health Insurance System. Thank you very much, Honorable Chairperson and honorable members.
Thank you very much, Deputy Minister. The first supplementary question will come from Honorable Nsube. Honorable Nsube.
No, thank you very much, Chairperson of the Council. Let me also thank the Deputy Minister of Health for giving honest response. Deputy Minister, having listened to your response, it appears to me that the pandemic has basically forced us to operate in the lines of national health insurance, like integration of financing and the provision of healthcare services. I want to check with you and your department that don't you think that this is a time to fast track the implementation of the NHI, because we believe that it is the only way to guarantee universal healthcare provision to the people of our county. Thank you very much, Honorable Chairperson. I submit.
Honorable Deputy Minister.
Thank you very much, Honorable Chair and honorable members. Indeed, this pandemic has highlighted the fact that we need to move with speed, because what we have been doing now with very limited resources split between the private and the public health sector was really more of stopgap. What is required in terms of long-term readiness is the pooling of all health resources, human resources, the infrastructure, rather than what we have done during this period, where we had to, on an impromptu basis, go out and recruit, including also volunteers, health professionals, and also community health workers, also looking at entering into agreements with private providers, including private healthcare, private hospitals, and private laboratories. But once we can pull all these resources together and create one national health service under the NHI, pandemics like the COVID-19 will be managed with a lot more certainty, because instead of spending a lot of time in negotiations, entering into agreements, we would have this as a standing arrangement in terms of where there is no major division between public and private, and also with the financial resources, we will be able to pull all those resources and plan even emergency services, laboratories, everything. So indeed, I agree with the honorable member that NHI will go a long way to ready us for future pandemics. Thank you, Honorable Chair.
Thank you, Deputy Minister. The second supplementary question will come from Honorable H.S. Boshoff. Honorable Boshoff.
Good afternoon, Honorable Chair and Honorable Deputy Minister. DP, speaking of COVID-19 and how each province performed in handling the pandemic, where the majority of the provinces failed dismally in preparing for the peak, how would the ordinary South African be assured that the NHI model won't be used just to buy more scooter ambulances, providing tenders for connected cadres, or is the NHI designed for a competent government like the DA in the Western Cape? Thank you, Honorable Chair.
Honorable Deputy Minister.
Well, let me start by saying, unfortunately, I don't know whether our honorable colleagues in the DA can ever, just focus on South Africa as a whole, because South Africa is a unitary country with provinces for administrative purposes, and our approach, as per the Constitution, is that we are a unitary country. Now, the assertion to say that majority of provinces failed dismally is indeed unfounded in terms of fact, because all provinces, in our view, all provinces did their best. And I don't even know on what basis the honorable member wants to single out the Western Cape, because there was no different performance. If we look at the facts, if you look at the statistics in terms of the number of infections, the ability to contact trace, to quarantine, as an example, in terms of the contact tracing and quarantining, the Western Cape province at its peak had major difficulties, with a result where a national government had to come in. Even the president came to visit the province and made available national resources to make sure that we can procure more beds and also make sure that we can also expand quarantine facilities. But only about 20% of those quarantine facilities were used, with the majority of people who should go into that either as contacts or also for isolation, very reluctant, because they were not properly mobilized to use those facilities. And together as a team of health leaders in the country, we work together as one team. And because the COVID doesn't know the boundaries, people move from across, and we all had to work together. So I would say that it was actually a major foundation to remind us that we're a unitary country and that diseases don't know any boundaries, and we need to work together. And I think we do it well as a team. And I would therefore disagree with any attempt to want to isolate one particular area and say it was the best. There is no, in our view, we've been able to contain this up to where we are working as a team. Thank you, Honorable Chair.
Yes. The third supplementary question comes from Honorable S.A. Lutuli. Honorable Lutuli.
Thank you, Chairperson. Deputy Minister, since the Health Department has suffered from general mismanagement for decades,
If the table can try to assist the honorable member,
as well as staff and equipment of the sector and the fight against COVID-19. Can you hear me now, Chair?
Yes, I can hear you now.
Okay, thank you. Deputy Minister, since the Health Department has suffered from general mismanagement for decades and during the pandemic, PPE procurement fraud as well as staff and equipment shortage, despite money being channeled towards the sector and the fight against COVID-19, what guarantees do we have that the funds meant for NHS as opposed to serving their intended purpose? Thank you.
Deputy Minister.
Well, firstly, let me disagree with the honorable member in saying the health department and the health sector has generally suffered from mismanagement for decades. We have had our challenges in a number of areas which we have addressed and continue to address. As you would know, late last year, there was even a process through which Minister Mkhize, on behalf of the ministry and the department, working with the president, launched a health sector anti-corruption network, working with law enforcement agencies such as the SIU, the police, and various other, the NPA, and all other law enforcement agencies, and also as civil society and also private sector, to monitor all issues related to mismanagement and corruption. And as a result of that, also through the president making sure that through the Auditor General, instructing the Auditor General's office to get involved very early rather than the usual auditing after the fact. We were constantly in touch with the Auditor General, and also the SIU has been involved. And indeed, it is not correct to say that during this period, there was generally mismanagement. Where there were areas of mismanagement, they were identified, and once they were identified, intervention was made. And through all this, we have laid the foundation also for proper management and making sure that public resources will be utilized properly once the NHI is instituted. Thank you, Honorable Chair.
No, thank you very much. The fourth and last supplementary question come from Honorable Member S. Inufaela.
Honorable Chairperson.
Honorable Inufaela.
Yes, Honorable Chairperson, Honorable Deputy Minister. Does the department think South Africa has enough resources to successfully implement the national health insurance? Given the fact that within the NHI bill, citizens are restricted to using only NHI accredited primary healthcare facilities. Is there any guarantee, Minister, that those facilities will offer high quality services. I thank you, Minister.
Deputy Minister.
Thank you very much, honorable members, honorable chairperson, and the question from the honorable member. We can never say resources are enough, but what the NHI and its basis and foundation is striving to achieve is optimal and properly coordinated utilization of resources, because it's only, if you look at the current moment, somebody can argue that those who are able to access private health care have the best, and therefore that's where the optimal resources are and services and facilities. But as we have seen through the former Chief Justice Ngobo Commission on the health market inquiry, that health market inquiry report reveals that there is a lot of wastage and also overcharging and a lot of resources which could be put to good use by South African citizens, overcharged, overused. And if we are to make sure that all those are properly coordinated, we would be able to make sure that in terms of human resources, in terms of equipment, in terms of facilities, hospitals, clinics, and medicines and everything, once all these resources are put together and properly coordinated from a level of, if somebody needs just a primary healthcare, a GP or a primary healthcare nurse to look at a headache, they don't have to go and have a brain scan from, but what we know from that health market inquiry is that there's a lot of abuse so that people can pay more. And that's why our medical aid get run out sometime by June. And by the time you reach August, it's finished because of some of these problems. So this bill, and which were put before Parliament and the plan, it's actually to make sure that all these resources can be maximally utilized, and so that those who need care at a certain level can access it, and those who are not sick enough, it just need some assistance, prevention and early treatment can be able to be catered for by general practitioners and also at the clinics. Because currently the difficulty is that some of it's a fact which is revealed, it's confirmed in that health market inquiry and other investigations. Unfortunately, some of this healthcare, private healthcare, when they look at your medical aid and they see you still have a balance, when you could simply just be checked and get a blood pressure and so on, for a headache, then they send you for a scan, for the brain scan. So those are the problems which are bedeviling us. And once we rationalize these resources equitably, we'll be able to achieve a lot, honorable members. Thank you.
No, thank you very much, Deputy Minister. The next question is question number 68. And the question is on medico-legal dilemma. This question has been put forward by Honorable T.C. Christian of the Northern Cape, and is directed to the Minister of Health. Honorable Deputy Minister.
Thank you very much again, Honorable Chair and honorable members. To the member who asked the question, indeed, the department has put measures in place to mitigate against the effects of what the honorable member calls the dilemma of the medical legal claims. Amongst the interventions which have been put in place is to make sure that, amongst others, we can use mediation, that in order to have mediation as one of the avenues to resolve where there's a dispute in terms of the health outcomes. We have now amended the patient admission form, which has been reviewed and has been considered and approved by the National Health Council, which is where the minister and the MECs meet, to look at a provision in the form to make sure that the admission form where the patient is admitted does indicate that in the case of a dispute or some unhappiness, one of the steps to be accepted as intervention is mediation. There are already a number of officials across the country, in all provinces, who are being trained both from the legal profession and also from medical side. They have been trained in this mediation, because we have found that sometimes it's just the lack of communication which ends up with big costs in the courts. Secondly, the provision of future medical treatment. The department has published public health facilities in a government gazette on the 5th of September 2019 to provide for future medical services instead of a lump sum claim, because we pay a lot of money of lump sum where it is claimed for future medical costs. So through this publishing of these facilities, for instance, for children with cerebral palsy, which is a major claim to government at the current moment, by showing that we can be able, in public facilities, look after these children who have suffered certain defects like cerebral palsy, then we can make sure that the lump sum which is now being paid to go to private sector can actually, the cost of medical care can be done in public facilities. Also, through assistance from the Justice Department, the Justice and Correctional Service is currently looking at the amendment of the State Liability Act. That is the State Liability Bill, which will also make provision that the things which I've mentioned about treatment in public facilities will then be catered for, and also have a legal framework also to cater for the fact that we don't have to pay lump sum. It can also be staggered where it's not health costs, but also other costs. It can be staggered rather than a lump sum. These are some of the things which are being catered for in this amended bill. But also the State Law Reform Commission is also looking at other legal means through which further avenues, as I've mentioned, mediation, for instance, and again, also the staggered payment, that they can be reformed in the law so that there can be other means through which, when there's a dispute, it can be settled. Case management has also been introduced from the National Department with provinces to create a facility through which national and provinces can work together to trace this litigation so that there can be a systematic way of intervening. And lastly, we've also embarked on forensic investigations where we put together teams which go and look at some of these claims and see which are the legal firms which are mainly pursuing this, what is the basis, are they all genuine? And I must say that through this, some of the claims have already been stopped because they were found to be actually very frivolous and non-existent. So these are some of the steps which have been taken to mitigate against the cost of this litigation. Thank you, Honorable Chair and members.
No, thank you very much. Although question number 68 has been asked by Honorable DC Christian, I've been informed that Honorable Bach is standing in for Honorable Christian, and therefore the first supplementary question will come from Honorable Bach. Honorable Bach.
Thank you, Chairperson. Deputy Minister, the DA supports appropriate, fair, and sustainable compensation of victims of medical negligence. But the current medical legal environment is afflicted with the following serious problems: a lack of limits on contingency fee payments based on large lump sum awards, which often leave the attorney better off than the victim, a lack of alternate dispute resolution mechanisms like mediation in specialized courts to reduce legal costs, a lack of expert witness panels serving the courts, not attorneys, to lessen the moderate spurious claims. This state of affairs has rendered many medical professionals simply uninsurable and has led to many leaving the practice. What concrete measures is the ministry taking to intervene in this kind of crisis? Thank you, Chairperson.
Honorable Deputy Minister.
Well, thank you, Honorable Chair. I'm indeed very pleased that the DA also on this matter, in a way, in a large measure, agrees with us. As much as the honorable member says, where there's been negligence, fair compensation, of course, we also support that, to say it shouldn't be that negligence should be condoned, and where it has happened, there must be relief to those who have suffered. But I agree that the current system is just not sustainable. And therefore, as I've indicated, there are short-term interventions where we're making sure that, one, that we can improve just in terms of saving the public funds and making sure that funds which are allocated to provide services as much as possible should be spent on services rather than huge legal costs and paying in terms of these contingency fees. So that's why I've mentioned, for instance, the case management system in which we're working together. We've put together some professionals, legal people, financial people, medical health people, so that they can examine some of these things, and where there's frivolous and vexatious claims, they can be identified. And a lot has already been saved. In some cases, bringing in even the SIU, where some of the people are taking chances. The legal firms, which are even advertising on radio to say, come to us if you have any complaint against a health practitioner or a health facility. So these are the things which they've just replaced the road accident fund with claims for medical negligence. So those interventions are there. Forensic investigations, immediate. This is what we're doing to limit. But in the long term, as the honorable members has indicated, that there has to be a different approach. So we're looking at the law, working with the Justice and Correctional Services and the Law Reform Commission to make sure that the law, as in other countries, there must be some limits and some parameters in terms of this can be done this way, and if you do it this way, this is the limit. If indeed there is this kind of negligence, these are the areas. Medical care can be done not only in private but also in the public, and so on. And where there must be some finances, there must also be some control. So indeed, we are going in the direction in which the honorable member is saying. Thank you.
Thank you very much, Mr. Minister. The second supplementary question comes from Honorable M.E. Nchabele. Honorable Nchabele.
Thank you, Chairperson. Thank you, Deputy Minister, for the response. It is indeed very comprehensive. Chairperson, the department has developed a case management system to help track the medico-legal cases. The system has already been rolled out in some of the provinces. What I would like to know is, when will it be rolled out to the rest of the country? Thank you.
Deputy Minister.
Thank you very much, Honorable Chair and the Honorable Member. Indeed, because this, we have to put together the teams of expertise, as I said, both from forensic, legal, medical, and also make sure that there is training, because all these interventions will indeed only be effective. It starts right in the health facility, like the hospital, the records. Do we have the records? Making sure that people are properly trained to know the importance, even clinical clinicians, to make sure that when they write the records, they write in a manner in which somebody else can be able to read, so that when the records are retrieved. So all these things, because for them to be finally very, very effective, there has to be proper training, sourcing of the necessary expertise. So this is being rolled out currently. There are 4 provinces where the systems are already working. We expect that at the latest, by the middle of next year, this should have been rolled out at the latest to all the provinces, because provinces like Gauteng, Eastern Cape, for instance, need intervention very urgently, where we're sitting at billions of claims at the current moment, some of which indeed are not justifiable claims. So only through this case management and the forensic investigation will we be able to identify those. So we're working with colleagues, the MECs, head of departments in the provinces, to make sure that the intervention systems are rolled out. And as I've said, we expect at the latest by middle of next year, we should have reached all the provinces. Thank you, Honorable Chair.
Thank you very much, Deputy Minister. The third supplementary question comes from Honorable A.B. Klute. Honorable Klute.
Thank you, Chairperson. Honorable Deputy Minister, 80.4 billion rand, that was the amount South Africans taxpayers paid by 2018 for medico legal claims. Now, the AG also flagged and expressed his concern about the amounts provinces especially had to pay for these legal claims, which kind of begs the question, who will be responsible for these claims under NHI? But that's not my question. I would like to point to Cuban doctors. Now, we know Cuban doctors are very, let's say, highly specialized in training, but not in general practicing. So my question to you, Deputy Minister, currently, as we stand now, because there are processes to streamline, like you said, but currently, does government also allow for claims against Cuban doctors in state hospitals? And has there been such claims, to your knowledge?
Deputy Minister.
Well, thank you very much. Let me firstly correct the honorable member that the health departments did not pay 80.4 billion rand in 2018. This was the composite liability, the claims. There's a difference between what the lawyers have put as a claim totally when you add all provinces and what was actually paid. So otherwise, there will be no health budget left. If in 1 year the health sector lost, the public health sector lost 80.4 billion rand. This is just an understanding of what it means. This is the amount which was on the roll in terms of when you add all the claims from the 9 provinces. But as I said, through these processes of checking and so on, some of these don't even end up in court, because once we do proper work with our case management system and forensic, some of these ones just withdraw, because many of them take chances, and therefore just to correct that, so that the public is not left with the wrong impression that this is what was paid. This is just the claims which were put there. Doctors, all doctors, whether you are Cuban, whether you come from Cuba, whether you come from Germany, whether you come from the UK, as long as you are employed in the public health sector, you are treated the same. So if there is negligence, firstly, the claim will come to the state. And that's what the claimants will say, Minister of Health, plus the MEC, and so on and so on. And then, depending on the nature of the case, once there's identified that it can be zeroed into an individual health practitioner, whether it's a nurse or a doctor or a pharmacist or a physiotherapist or any practitioner. It doesn't matter which country they originated from. If they are employees of the state is the one which is liable. But once it is zeroed into an individual based on the professional council to which that individual belongs, that matter will then also proceed for that person to face the music in the health profession, in the professional council which they belong to. If it's a doctor, it will be the health professions council. If it's a nurse, nursing council. If it's a pharmacist, nursing pharmacy council, and so on and so on. So it doesn't, the question, I know the honorable members, especially from the DA, are very much, sort of so much caught up with, obsession about anti-Cuba. We don't employ doctors and then say, we don't say you are Cuban, you are American.
Deputy Minister, just a minute. Honorable Labuschagne, what is your point of order?
I just want to raise the point of order that the Honorable Klute is not from the DA. Thank you, Chairman.
Okay.
Let's note the correction.
Bafana.
Very much.
I withdraw the DA part. But the fact is that we treat all our employees as employees of the government of South Africa, Department of Health. It doesn't matter which country they originate from. Thank you, Honorable Chair.
Sub-bench.
Thank
Deputy
you very
Minister.
much, Deputy Minister. We'll now move over to question number 58. And this question is on permanent employment of nurses. The question has been raised by Honorable K. Mutsamai from Gauteng and is directed to the Minister of Health. Deputy Minister.
Thank you again, Honorable Chair and honorable members. My response to this one will be fairly brief. During the COVID-19 surge, because we are still in the pandemic, we are not yet out, but we have had the peak or the surge around July, August, and right up to September. Nurses, because this specifically talks to nurses, nurses were employed on a temporary basis to specifically capacitate the health services to respond to additional demands for services due to the pandemic. The nurses were, amongst others, employed to assist in a whole continuum of care of COVID-19, starting with screening in the public, testing, screening and contact tracing, assisting at quarantine sites, and treatment of COVID-19 patients in general wards, as well as also in the intensive care wards. During this period, some nursing permanent posts were also filled because of the fact that we were able to get some additional funding from the Treasury. So some posts in line with the organograms of the various health departments, some of the posts were filled on a permanent basis, depending on availability of budget. As long as budgets were provided for, they were filled permanently. It is, however, not possible to employ all the nurses who were taken in at the peak and the surge on a temporary basis to now employ them on a permanent basis. And the reasons largely is that we just don't have the adequate resources to do so. But also the fact that some of those tasks were indeed temporary tasks. And as the surge is reducing, the provinces will have to also readjust their staffing, but keep enough capacity that if there's a sudden increase, they should still have capacity. We would have wished, because nurses are a very important resource for healthcare provision. We would, if we had all the adequate funding, we would have wished that all of those, not only nurses, but also other health professionals, including community health workers, would be employed permanently. But the reality of the situation, as honorable members will know, we coming from the medium-term budget policy statement not long ago, where the Minister of Finance spelled out clearly the fiscal situation of the country. Because of that reality, we are not able to promise that all those who are employed temporarily can now be employed permanently. So that is the response, Honorable Chairperson, and to the honorable members.
No, thank you very much, Deputy Minister. The first supplementary question comes from Honorable Mutsamai. Honorable Mutsamai.
On a point of order?
Yes.
It's Member Arnold's here.
Oh, okay.
Chairperson, can you please go back to the question that was asked by my name is there, but you didn't call my name out. Follow up 4.
Oh, okay, sorry.
EFF to be part of the meeting.
No. I can say that. Let's. Thank you very much. Let's go back to supplementary question 4. Arnold.
Thank you, Chairperson. Deputy Minister, the National Health Act 61 of 2003 provides the framework for a single healthcare system for South Africa, and also provide for a number of basic healthcare rights. Medical legal claims in South Africa are dealt with in terms of the common law because current policies do not provide guidance for dealing with this problem. The nature of the crisis is that our country is experiencing a very sharp increase in medical malpractice litigation. The cost of medical malpractice claims has skyrocketed and the number of claims increased substantially. Now, what, according to your knowledge and understanding, is the main reason for the enormous increase in medical legal litigation against the state? And what single intervention do you believe will have the biggest impact on improving the current situation? Thank you.
Deputy Minister, if you can just go back and just provide a response to this supplementary question.
Well, thank you very much, Honorable Chair, Honorable Member. Well, two broad factors. The first one, in the public health side, is just the enormous pressure of service. As you would be aware that, as I've alluded to earlier on, the burden of disease in South Africa is huge. Whether we talk about HIV, TB, infectious diseases, now COVID, non-communicable diseases, hypertension, diabetes, heart disease, all those, the burden in South Africa because of various socioeconomic factors, the social determinants of health, lack of some basic facilities, clean water, housing, and also just in terms of our own ability to look after ourselves in terms of the kind of diet we eat, and also some social behavior, smoking, abuse of alcohol, and all those things, lack of exercise. We contribute to a whole burden of disease, and then of course add to that violence, in families, on the roads, and so on. So our facilities are highly burdened, and therefore our health workers work under immense pressure. And as a result, mistakes do happen. Here and there, you will find where there are some bad apples, where things which shouldn't have happened at all do happen, but huge burden in terms of pressure. So that's one aspect which makes our system very vulnerable. But the second issue is in terms of just the greed as well, from from various parts. Greed is across the country, whether we talk about tendering, what, and so on. And the medical, the health fraternity has not escaped that. A lot of what used to happen with the road accident fund, which has now collapsed, has now moved to health litigation, where you find frivolous and spurious claims also happening. So that's why it's not only in the public sector. That's why this is also driving even private practitioners out of service. The protection plan for professionals, insurance, is now running at no less than R1 million for one health professional per year, which is unaffordable. So the intervention, therefore, as I've mentioned, one is to improve efficiencies in terms of protecting the public health, making sure that there's proper management, and also systems and protocols from the admission at the office, where the clerks, where they issue cards, making sure that there's proper records, clinicians keep proper records, those records are properly secured, because sometimes also what we have experienced because of this fraud, some of our own selfish health workers, some have been found to be colluding with some of these fraudulent people, stealing even health records. So we have to secure the records and make sure that so all those things can be defended. But also changing of the legal framework, as you have said, there is a gap in the legal framework. So through the South African law reform and also Ministry of Justice and Correctional Services, we are also addressing the legal framework. Thank you, Honorable Chair.
No, thank you very much, Deputy Minister. Well, apology to Honorable Arnold there, and apology to the Deputy Minister.
Apology accepted, Chairperson.
You have noted that the Minister had already dealt with the first part of the question from Honorable Mutsamai, that's question 58. We'll now move over back to Honorable Samai for his first supplementary question on question 58.
Thank you,
Honorable Samai.
Chairperson. Thank you, Chairperson. Deputy Minister, as is spoken here by the EFF, when we made our tribute to healthcare workers for the work they did during South African Workers' Days, Worst Days of COVID-19 epidemic, the real heroes who were on the front line daily are indeed our healthcare workers. It seems, however, that nurses are thankless job when one consider the working consideration and salaries of nurses over and above. Employers of nurses on a permanent basis. What does your department intend to do regarding the salaries of those nurses? I thank you, Chair.
Apla.
Thank you very much, Honorable Deputy Minister.
Thank you very much, Honorable Chairperson and the Honorable Member. I want to join the member in saying, indeed, as a ministry and as a department and as a government as a whole, we have on countless times expressed our deep appreciation for the healthcare workers of this country, because without their sacrifices, without their commitment, we would not have stabilized the country to the extent where now a lot of activity is now open. So indeed, he is not alone in viewing the health workers as heroes. We have been very upfront from the president, the minister, myself, and other members of government. We have been very upfront in saying, indeed, we are very thankful to the commitment of our healthcare workers, and indeed, they are our heroes. Now, so it cannot be correct to say we sort of seem to be not caring about them, that they are not being considered. We would, if everything was possible, I mean, we definitely would leave no stone unturned in making sure that these heroes of the people of South Africa can be properly, thanked and recognized. But due to limited resources, as I've mentioned, one, we've been discussing with the representatives issues around some recognition awards and so on have been raised, and those are matters which are on the table for discussion, but also the issue of making sure that those who made their services available on a temporary basis should be offered permanent positions. That indeed we agree, but as I've said, it's just that the current fiscal situation of the country is not making it possible for us. We would have wished, and as soon as there is an improvement in the financial position of the country and the department, we will indeed prioritize frontline healthcare workers to make sure that they are properly remunerated, and also that those who are making their services available can also be employed so that they have a sort of a security of tenure. So it's not out of not willing, but it's just out of the fact that we don't have the means at the current moment. Thanks, Chair. Honorable Chairperson.
Thank you very much, Deputy Minister. The next question, supplementary question, second supplementary question comes from S. Infaela.
Honorable Chairperson, yes, Honorable Chairperson, Honorable Deputy Minister, given the fact that KwaZulu-Natal had a total of 3,561 COVID-19 cases amongst healthcare professionals as of August 2020, whether any efforts have been made by the department to, one, conduct a comprehensive study to determine the psychological effects of the pandemic on nurses, and B, offer a support to nurses' mental health given the stresses of being a healthcare worker during the pandemic. Two, whether the minister had any strategies in place to ensure that the department remains competitive employer of choice to allow for a retention of nurses? And three, what progress has been made regarding the recruitment, training, and placement of experienced ICU and high care nurses after the National Assembly presented that there was a shortage of them? I thank you, Deputy Minister.
Deputy Minister.
Thank you very much, Honorable Member, Honorable Chairperson. Indeed, one of the sad, realities of the COVID-19 pandemic is that because of the nature of the work of our healthcare workers, they remain exposed. They work under very stressful conditions on a daily basis. They have to travel back to their families, who also, so the stress is not just on the healthcare worker, but it's also on the families, because they don't know every day when their mother, their sister, their father comes back from work, whether they bring the virus to the family. So that's the reality of what we are going through. So, and we have lost quite a number of health workers. I think the last count is just under 400. Very regrettable that this has happened. So indeed, we have been working together with the representatives of various worker organizations to make sure that we indeed provide the necessary services, facilities for psychosocial support, not only physical support, but also psychosocial support. We've been creating the health safety committees. We've insisted that there must be health safety committees at all healthcare institutions, hospital, clinics, and we also brought in the National Institute of Communicable Disease of Occupational Health, National Institute of Occupational Health, to work with us to monitor these health committees in the various institutions, health safety committees in the various institutions. And we have said that amongst the services which must be prioritized is psychological support. Make sure that where we don't have, we must source out psychologists and psychiatrists and social workers who can give this support, not only to the worker, but also to families.
The table must try. Please proceed, Honorable Deputy Minister.
Making the Department employer of choice, of course, as I've said, we would like to provide even much more support and also even more competitive sort of recognition, including a better remuneration and recognition of excellence of service, but limited resources. But we have also emphasized that some of this doesn't have to be financial. We have encouraged our managers at various levels to even just recognize, the good services by various healthcare workers, even if it's just, small price. I mean, not necessarily financial, but just a proper recognition that it goes a long way. Recruitment of nurses and other professionals for ICU and high care, definitely this is also our priority in terms of during the peak, when we looked at various skills. We also we're also looking at ICU because as members would be aware that the need for more ICU beds was quite expanded, high care, high flow oxygen. So indeed, unfortunately, in some cases, we also had to do temporary employment, but where it's possible to can retain some of these professionals, we will do our best to make sure that they are retained within the service. Thank you, Honorable Chair.
Well, thank you very much, Deputy Minister. The third supplementary question comes from Honorable Ndongeni. Honorable Ndongeni.
Enkosi Sihlalo. Enkosi Sekela Mphathiswa ngempendulo zakho ezicacileyo. Kwezinye indawo ndiphendulekile. Ucacisile malunga nabasebenzi abasisigxina ukuba baqashiwe ngeli xesha le-COVID-19. Umbuzo kumaxa sindawoni ukugcwalisa ezinye izithuba ezivunyiweyo kumanqanaba olawulo lwamaphondo kunye nohlahlo-mali eliphunyeziweyo. Enkosi Sihlalo, enkosi Sekela Mphathiswa.
Thank you very much, Honorable Deputy Minister.
Honorable Chair, as much as I try to be very knowledgeable on all 11 languages, the honorable member went into some fairly deep Xhosa, which lost me in some areas. So I lost some of the gist. I had not put on, I thought I could follow without any translation. I don't know how, I think I might be shortchanging her.
Why don't we try and get the Honorable Dongeni just to repeat again, just to repeat the question. We'll sort it out thereafter.
Yeah, if you can,
Honorable Dongeni?
less deeper in the course, just more lighter one. Which
no, as a former teacher, she'll try.
Okay, Enkosi Sihlalo. Sekela Mphathiswa. Thank you, Honorable Deputy Minister, for answer you have provided to questions. Deputy Minister, I understand that the department has filled some permanent posts during this COVID-19 period. How close are we from fulfilling all the vacant posts that are in the approved provincial organograms, approved budgets, and approved budget? That's my question.
Thank you very much for your understanding, Honorable Dongeni. Well, Honorable Member and Honorable Chair and members, it is our wish that all posts, first of all needs which have been identified through the assessment of needs at various institutions, that it is our wish that all the required posts in terms of those needs, because we do have a system through which the appropriate staffing norms have been identified. Now, once that is done, posts are, the needs are identified, the norms through the norms, and posts are created. Now, our wish actually is that in all those instances, all those posts can be funded so that they can be filled. But as I've indicated, we wish in the not so far future we will be there. But currently, what we are able to do with our colleagues in various provinces, and we have also been helping them to seek additional funding, which now and then we have been able to prioritize from other sources. And we've done our best to make sure that as much as possible, we can work with our colleagues in provinces to fund the majority of the posts which have been identified in terms of the staffing norms. Now, it's unfortunately, only in cases where such funding has been identified and been made provision for in the budget that we're able to fill those posts. And at the current moment, there will be very few. We can come back to the Honorable House to indicate the actual numbers, but over this period, we have stretched to make sure that, especially unless in cases where the necessary skills could not be found, but wherever the skills could be found, we have made sure that those posts get filled as long as they are budgeted for. Thank you, Honorable Chairperson.
No, thank you very much, Deputy Minister. The last supplementary question, which is the fourth supplementary question, comes from Honorable C. Labuschagne. Honorable Labuschagne.
Thank you, Chairperson. Honorable Deputy Minister, it has become patently obvious
that the ANC national government are more determined in investing in failed projects such as SAA instead of investing in the healthcare professionals that put their lives at risk to look after us, all of us, instead of the existing few and whom we all call heroes. Minister, Deputy Minister, the hypocrisy of this national government could not be more insulting to the people of South Africa. My question is, why would a national government with a struggling public healthcare system, especially during a pandemic, not spend all available resources on their healthcare infrastructure, such as more staff, than awarding another bailout for a failing state-owned airline? How could you allow that?
Honorable Deputy Minister.
Well, Chair, let me start by saying that the honorable member is totally disregarding serious interventions which were made. If the honorable member would remember, when the president announced the 500 billion intervention at the peak of the COVID, in that 500 billion, there was not less than 21 billion rand, which was made available to capacitate the health sector, which was the reason why we're able to see through, through the peak. Field hospitals, including in the convention center in Cape Town, various other field hospitals, putting, extra capacity across the country, employing more professionals, putting in money to improve testing capacity. Many of those interventions are going to be is a long-term investment. They were being put in to deal with the COVID-19, but those facilities are going to remain and expanding the capacity of the health sector. So this is not a question, you see, as the responsible government, we look after all South Africans and their needs. If you say what you're saying, for instance, to the employees of the SAA and their families who are losing their jobs and their livelihood, they will actually feel very hurt by the fact that you want to counterpose them, as if the airline is helped to resuscitate and be able to provide the service and provide, employment, it is counterposing against people having medicines, having doctors, which is not the case. South Africa is a wholesome country. You've got to look after the economic. SAA is not just an expenditure. It's also part of reviving the economy of the country, making sure that we get tourists from all over the world, making sure that our hotels are busy and there's economic. They bring in money into the country to inject into the life of the country, which makes sure that we can have taxes, we can be able to fund the very health services. So it is not really correct, the notion to say if you therefore, save the airline, that is counterposing, because we're looking at both saving health, saving lives, and also saving livelihood. So that's really our approach, Honorable Chairperson. Thank you.
Yeah.
Shame on you, DA.
Thank you very much.
No shame there.
I will now hand over to Honorable Ngwenya, but as I do so, the next question is question 53. The question is on minimizing effect of COVID-19. Question is being tabled by A.B. Klute and is directed to the Minister of Health. As I do so, I hand over to, as I indicate this, I hand over to Honorable Ngwenya. Deputy Minister.
Thank you very much. Thanks, Honorable Chair. Indeed, the health measures used during alert level 5, right up to level 2 of the national state of disaster, those measures have contributed positively towards minimizing the detrimental effect of COVID-19, as experienced by other countries that did not impose strict measures. As of the 2nd of November, the total number of South Africans infected was just over 725, and as of on the 3rd, it was over 728,000 confirmed cases and just over 19,000 deaths since the beginning of the epidemic. The country has moved from being ranked number 5 at the peak of the epidemic in July, and we are now ranked number 13 in the world as we speak, with a recovery rate of 90.2%. Our national case fatality rate compares favorably as of the 30th of October, compares favorably with other countries at 2.6% fatality rate. Nationally, we've been able to flatten the curve since the second week of September. If we take a 7-day moving average number of new cases by province, considered from April 2020, if we compare where we are now, the 7-day moving average has markedly declined compared to where we were at the peak in July. So we've made a lot of progress with these measures. These measures were also aimed at strengthening national and provincial mechanisms for detection, management, and containment of the virus, using, amongst others, the following interventions: provision of effective governance and leadership, including through mobilization of finances and resources required to curb the spread of COVID-19. Secondly, strengthening surveillance and strategic information systems at national and provincial level to monitor trends, guide policy actions, and swift change in responses based on the reports on the trends. Augmenting health systems readiness against the epidemiological curve by identifying gaps and planning to ensure that health services availability is improved according to the need, ensuring the ability to deliver these services and the required health workforce, medicines, equipment, products such as ventilators, high flow oxygen, nasal cannulas, and oxygen at all the facilities. Enhancing effective community engagement and communication through public health risks and other related mitigating factors, such as wearing masks, social distancing. We had to make sure that we communicate adequately about these measures of wearing masks, social distancing, restricting numbers attending events, including at funerals, religious events, and also sporting and other recreational events, and also protecting vulnerable population. Improving laboratory capacity and testing through the NHLS and other private laboratories, establishing clear continuum of care pathways and clinical guidelines, strengthening scale-up of infection and prevention control, also enhancing screening capacity at the ports of entry to make sure that we can limit importation of the virus. Lastly, expediting research and the introduction of new therapeutics, new diagnostics, and also working with various partners in the search for vaccines. So this serious lockdown interventions at the peak of the epidemic helped us to be where we are today, where we have been drastically reducing and from number 5 in the world to now standing at number 13 and still going down as others are rising. Thank you, Honorable Chairperson and members.
Thank you, Deputy Minister. I'll now call on Kluter for follow-up question. Honorable Kluter.
Thank you, Chairperson.
Honorable Kluter.
Can you hear me, Chairperson?
We can hear you.
Can you hear me?
Yes, I can hear you.
Thank you. Thank you.
Yes.
I'll continue. I just want to make one or two statements or give some background regarding the question, and it might be regarded as a kind of mustard after the meal, but we need to have a look at this as well. And I put the possibility that if the hard lockdown had been effective, the rate of infection would have dropped significantly 7 to 14 days after lockdown was implemented. Now, one would have expected that the rate of increase would have changed when lockdowns changed, but research found no such changes. In fact, during level 3, the pandemic peaked. So if lockdown regulations were having the intended effect, uh, Deputy President, one would expect the rate of infections to spike as restrictions were relaxed, but this did not happen. But let me come to my question. Uh, we all know about Professor David Nabaru recently said, now remember, he's the world's highest ranking expert on COVID-19. He said that the World Health Organization does not advocate lockdowns, since their only consequence is to make poor people poorer. He also went on to say the only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, and protect your healthcare workers who are exhausted. But by and large, we'd rather not do it, he said. Now, his comments aligns perfectly with grave concerns by many other healthcare workers regarding the damaging physical and mental health impacts of the prevailing COVID-19 policies. And I would like to point out to the great Barrington declarations that fully advocates fully reopening economies and letting those who are not especially at risk from COVID-19 to resume their normal lives, albeit with sensible hygiene practices. With that in mind, Minister, our society and our economy is still under a lockdown, to a lesser degree, but it is still under a lockdown. Now, the president will make an announcement next week. We hear the minister and the presidency has dubbed it his meeting with his family meeting. What has the department counseled the president in this regard, especially what Professor Nabaru said regarding lockdowns?
Can I come in, Honorable Chair? Honorable Chair. Okay.
Honorable Klute? Yes, Chair. Yes, Deputy Minister, you can respond.
Thank you very much, Honorable Chair. Firstly, let me just say to Honorable Klute, maybe his expectation was wrongly placed. The lockdown was brought in to flatten the curve. Now, that did happen because if he says that he expected that the numbers would go down after the lockdown, now maybe it's just maybe I don't know whether it's we failed in communicating, and if maybe we must re-examine our ability to communicate if even an honorable member misunderstands, because both at minister and ourselves and the president at countless occasions indicated that the hard lockdown was to flatten the infection, to stop a rise, a sudden rise in the infection rate, which would overwhelm the health facilities, which we have seen in various parts of the world, very advanced countries in the US, in a big city like New York, in Italy, in Spain, in the UK, including big cities like London, Paris, and Rome, and so on. So this is not theory. This is practically, we have seen it happening. And indeed, the lockdown did have that effect of flattening the curve, making sure that we don't have a spontaneous sort of a serious peak of infections immediately without us being ready to can handle that. That happened. So maybe if he expected a miracle of just a sudden dip, that of course was not expected. It was to keep it at the low base, which happened. Now, and the honorable member himself accepts the fact that the peak came in not at level 5, not at level 4, but at level 3. Because as honorable members would remember, when we went down to level 3 early in June, due to trying to make sure that there can be more life, social and economic more people can earn a living and relaxing and going down to level 3, allowing more and more, opening up a number of economic sectors, including mining, including restaurant sit-downs and all sorts of activities, some level of traveling. As we went down to that level, he himself says that's when the peak happened. Yes, because we then, at that stage, we have bought the time to prepare the foundation, the facilities, the staffing, the equipment, the oxygen, and everything. And we had to now give in to more economic and social activities. And that was expected, but still keeping in some of those. So indeed, um, um, contrary to what he is saying, it is the relaxation. But once we reach that level 3, and we're able, because we were ready with a number of testing and various interventions, we contained it. It did not overwhelm the health facilities. We're able to contain, even at the highest peak in Western Cape, when it moved to Gauteng, Eastern Cape, and everywhere, we're able to contain it. Not a single person, it would have been front pages if there were people who went to health facilities with COVID and they were just told there are no beds. It didn't happen because, in fact, on the contrary, some of the opposition parties were now saying we are wasting money by providing extra facilities. But if people had come in and there were no beds, they would be the first one to again to say, look, people have been turned back because there were no facilities. So we're ready. And it's only, that's why it was able to burn itself out through these containment measures. And we're then able to go to level 2 and to level 1, where now there is containment and we are just monitoring. So at the current moment, in terms of working with the whole, with the president and the cabinet and the coronavirus council, we're clear that we're at the stage where we're monitoring to see whether there could be a second wave. That's really what we're looking at and making sure that we are ready. So let me leave it there, Honorable Chair.
Yes, read, Honorable Fuji.
Good. Batshele.
I'm finished, Honorable Chair. I hope you can still hear me.
Thanks, Deputy Minister. Into zabelungu lezi ziyahamba zibuye.
We can't hear the chairperson.
We can't hear you, Chairperson.
As the chairperson is trying, can we continue? The next follow-up is Honorable President.
Thank you, Chair. May I proceed?
Yes, please, we will, Honorable Ngwenya will, he will be coming back, but you can continue.
Understood, Chair. Honourable Deputy Minister, I think most of us would agree that the initial lockdown was essential to flatten the curve, as you say. The problem is that your government adopted a sledgehammer approach, not a scalpel approach. And those severe regulations decimated the economy, adding millions to the unemployed, wreaked havoc amongst the middle class who had worked hard who through hard work fought to improve their lives and contribute to our fiscus, and destroyed thousands of businesses who, in spite of national government, kept our country afloat. With the tanking economy, more lives have been negatively affected, adding more strain to our healthcare and social services than the virus itself. So the question to you, Honourable Deputy Minister, is should a second wave of COVID infections or another pandemic become evident, will you adopt a proactive, scientifically driven approach that targets the problem in a surgically accurate manner, rather than the economically disastrous blanket approach which you and your government adopted the last time around? Thank you.
Well, thank you, Honorable Chair. Can
yes,
I
continue, Deputy Minister? She's still struggling with the network, so you may continue.
Thank you, Deputy Chair. Thanks, Honorable Member. Well, Honorable Member, we definitely differ with you in saying we used a sledgehammer approach. The kind of measures which were taken on a very temporary basis were indeed very necessary, as I've said earlier on, and in terms of containment, and also giving us, it helped to contain by limiting movement, limiting activities, limiting gatherings, including economic activity, social gatherings, and even economic activity. It was a necessary sacrifice. And we are convinced that, therefore, it was a long-term or a medium-term investment, in the sense that when you look at countries which did not do some of the things we did, and who thought this would be too hard, looking at countries like Belgium, Sweden, and in some parts of the US. Now, I mean, some of those countries which took half measures and were afraid to go all the way in terms of making sure that they can nip this pandemic in the bud, they have to come back now and do what we did much earlier. Now, you may not agree with that, but indeed, this is the science is there, and you may be quoting, you know, you're very selective in quoting one particular professor, but there are many other, you know, specialists, including in the WHO and in South Africa itself and various other places, who actually point out the fact that through these decisive steps, we have laid the foundation where we can now build. As to what would we do, we're busy now, you know, making sure that we streamline our plans. Firstly, proactively monitoring, looking at the flames, as Professor Karim has said to us, looking at the flames before they become fires. We're monitoring on a 7-day, 14-day, and we identify an area, we move into it. We work with the health providers in the area and make sure we can trace, we can quarantine, and make sure that we can intervene and so on. So indeed, we have learned in terms of what we have done. We have laid the foundation. Even our facilities will not, that's why we said, even as the rate is going down, don't dismantle everything. We don't want to start from scratch. If there's a second wave, we'll try and stop it before it becomes a fire. But in the case where it does become, we will make sure that we quickly resuscitate the facilities we have. So we will monitor scientifically. We have done scientifically, and we disagree with you that we have not done things in a scientific approach. So we will continue. That's why even when we opened up, there were a lot of demands, some of which, you know, maybe because I always assume that the people who are opposed are from the main opposition, but whichever opposition you come from, but I know you supported when the president imposed, and then you jump ship, you know, taking very opportunistically. So, but we want to say to the people of South Africa that we are a responsible government. Whatever we do will be to save lives, but also to save livelihoods. So that is our approach. Thank you.
Point of order, Chair.
Yeah. Tell 3 million unemployed people that. Deputy Minister, tell that to 3 million unemployed people.
Point of order, please, Chair.
We have order.
Thank you, Deputy Minister. The next speaker is Honorable.
Point of order, please, Chair.
Thanks, Chair. Can I proceed, Chair?
Chair, am I not being recognized?
Honorable Member Ryder, I don't know what are you saying, because I've got a problem of network. You want me to recognize on what to say?
Point of order, please, Chair. Chair, I'll go ahead with the point of order and just say that the Deputy Minister is accusing the opposition of dumping the President, when in fact it was the other way around, because it was the President that went against
Honorable Klute, you are out of order. There's no point of order on that.
Now she can hear you quite well.
Me because I was out.
It's a point of argument.
Now she hears
Can I
well. Now
proceed,
there's no
Honorable
problem
Chair?
with her network.
Please.
Honorable members, order please. Honorable members, can you please allow the Chief Whip to assist me? I was calling Honorable Nzube Chief Whip, but now there's this point of order. Can you please help me?
No, I'm happy you have made a ruling, Honorable Chair. I want to abide with your ruling that it was just a recycled argument. It was not a point of order what the Honorable Member wanted to make. Thanks.
Honorable Thanks Chair. Very much, Chief Whip. Honorable Nzube, can you please ask your follow-up question?
No, thanks.
Honorable Nzube, thank you. Speak.
Thanks, Honorable Chairperson. I think Deputy Minister of Health have since covered the largely part of the question that I wanted to raise. But however, Deputy Minister, listening to your answer, it is evident that different lockdown stages did not only contribute towards minimizing the effect of COVID-19, but also assisted in providing the space to get health system ready for epidemiological curve. Deputy Minister, as we have seen in the past and just now in the plenary, there's been a hullabaloo by particularly the opposition that we should have lifted the lockdown. We shouldn't have done this. Can you please emphasize this, that if we did not have a hard lockdown in the beginning, would we have yielded the positive results that we are seeing today, Deputy Minister? Thank you very much.
Thanks very much, Honorable Member, Honorable Minister.
Thank you very much, Honorable Chair. Indeed, as I've emphasized, we have got ample evidence to see. As we are here, Honorable Members, you just have to look at a number of countries of people who harbored some denialist approach. Some of them heads of state saying this will go away like a flu. But what disastrous impact has that had? As we speak now, just to give us an example, I mean, we know the current president of the U.S. kept on promising people that as the weather improves and as this and that, it will just be like a flu, it will disappear and it will be gone. But even this week, as they were going into elections, they were actually at a higher peak than even before, with more than 100,000 infections per day as a country. And there are a number of other countries in Europe and in the Northern Hemisphere who are going through the same experience, especially those who didn't do the kind of steps we took. On the contrary, if you look on the other side, examples like China, which went in a very severe intervention right at the beginning, they've been able to contain and they're still very stable. But let me also just as emphasizing that to say, I know a number of opposition also keep on saying that even now, we are still suppressing economic activity. We should open up everything. This will be, if we just, tell people that there's nothing to worry about, it means no need to wear masks, no need to social distance, no need to avoid crowds. That's exactly what they're saying, that if they were in charge, they would go in that way. There will be disaster. So we are going to always be responsible and we will not advise our people to go in the direction which will really endanger their lives and the lives of those around them. So we indeed still believe that the steps which were taken, we are now, as the president announced, focusing on economic recovery. Some of those jobs were lost on a temporary basis. And as the economy opens up and as more and more activities start to be generated, more and more jobs will be created. But this is not a unique experience for South Africa. I mean, even many of those advanced countries lost millions of jobs, contracted. Even if you take a country like US, UK, contraction of more than 8%. So we're not alone in terms of the impact of the interventions and the pandemic itself. So indeed, we believe that we have always acted responsibly. Thank you very much, Honorable Chair.
Thank you, Deputy Minister. The next follow-up question, Minister, was asked by Honorable Mkause.
Thank you, House Chairperson. Honorable Minister, in some of your responses during this process of answering questions, the arrogance, the way you attend to the matters is extremely worrisome, considering the fact that there are a lot of South Africans who actually lost their lives, some who could not even afford healthcare services in the same country that you are administering. But nonetheless, Honorable Minister, considering the strengths and weaknesses of the various lockdown stages as communicated by your minister, what will you do differently? Should there be a second wave that would require drastic measures in order to safeguard ordinary lives of South Africans, considering the fact that we do not have a healthcare system in South Africa? We've got a healthcare service. A healthcare system, Honorable Deputy Minister, should actually speak to all the departments who are in fact important in one's life. So in South Africa, it's not a healthcare system, it's a service that you are giving to our people. Thank you.
Thank you, Honorable Mkause. Honorable Deputy Minister, can you please respond?
Thank you very much, Honorable Chair. Well, firstly, let me say I don't know where the honorable member, has an impression that I'm responding in an arrogant way. I'm simply stating the facts in terms of how we have responded to challenges, and I think she has a right to have her own views, but I can't do anything to change views. But I don't agree with that. Now, we indeed are very grateful for the way in which South Africans have, worked together with the government in terms of dealing with a very serious challenge, a pandemic which has ravaged not only our country but the world. So we have, through the president and through other various platforms, we have always, expressed our full gratitude, not only to the health workers, but to the way in which South Africans of all walks of life have actually, assisted in making sure that we can save lives and also save livelihoods. Now, in terms of how we would act differently, and the honorable member saying we have a service and not a system. Indeed, we don't have a perfect health system. There's a lot of weaknesses. First of all, as I've mentioned in earlier questions, fragmentation between private and public. Also within the public sector, in terms of our political system, sometimes it shows weaknesses in terms of our architecture, in terms of things done at the different spheres of government, sometimes not talking to each other. But during this COVID, I think there was a lot of improvement in terms of those. Going forward, as I've already mentioned, we are indeed quite confident that with the foundation which has been laid in terms of containment measures, in terms of readiness for intervention, in terms of testing, screening, those who need to be quarantined, doing so, who are contacts, those who have shown symptoms and are positive, finding facilities for isolation. We are on constant basis. We are monitoring how things are going in district by district, not just in each province, but quite often when we have our coronavirus council meeting, we also go down into districts to see when there is a flare up in the Free State, which district is it, which local municipality is it, so that we can go right down up to the locality, so that in the case of a second wave, it will not get us by surprise. We will be able to monitor it, and the basic tools remain the same. It's prevention in terms of face masks, social distancing, avoiding crowds, and also making sure that when there's a warning in terms of the fact that there are a number of infections, make sure that our, our health workers move in, do the testing, do the screening, find the contacts, isolate them, and then there's no other miracle until we get a vaccine. So we will be just making sure that all these tools, all these systems which have been tried and tested can actually be utilized maximally through our alert system and monitoring, which is already working. Thank you, Honorable Chair.
Yes, thank you.
Thank you very much, Honorable Minister, Deputy Minister, honorable members. I would like now to call the Deputy Minister to respond the question on behalf of the Minister. I now call the Honorable Deputy Minister of the Sports, Art and Culture to respond to the question number 72 that have asked by Honorable DC Christian. But honorable members, I want to remind you that that question is a follow-up question will be done by Honorable Baha. Honorable Deputy Minister of Sports and Art and Culture.
Thank you very much.
Deputy Chair, the only thing that we forgot to say is Honorable Dr. Harla is done with the questions in terms of responding to his questions. And just to appreciate her being here, just to remind you, Deputy Chair, so that we proceed to the next Honorable member.
It's the House Chair.
Yes, okay, House Chair, thank you. You are interchanging, so I get confused myself.
Niyasithanda isikhundla.
Lalela baba, sisebenza manje.
Order. Asebenzeni. Kwenzakalani? I've got a guy in front of me that I must also ask the Deputy Minister on question number 72.
Thank you very much, House Chair.
What you are saying, you said I must pass question number 72 and go to 73. I don't understand.
House Chair, would you like to phone a friend?
No. No.
Can I proceed, House Chair?
Can I chair the session?
I think so.
Deputy Minister, ngoba bengilongihlushwa ulo Zoom wami ngingena ngiphuma ngathi khona okungishiyile kungakho ngicela ukuthi uChief Whip ang-assiste or itafula lingis-assiste. I was instructed that I must do these questions, question number 72 and question number 73 after ngiqeda ngale ngiqeda ukuyenza khona manje.
No, you are proper, Chairperson.
We, House Chair.
Yeah,
House Chair.
Yes,
all what I was saying was not changing any proceedings, but I accept that you're saying that your connection from time to time, you don't follow, the audience was poor. So all what I was saying was that we thank the Deputy Minister of Health for being here in the House and is done so that we move smoothly to the next Deputy Minister of Sports with regard to responding to question. Yeah, so it was just that matter, the House Chair. Otherwise, nothing bad. You can just acknowledge the Deputy Minister of Health. We are done, and then we proceed to the Deputy Minister of Sports.
Thanks very much, Chief Whip, for your clarification. That means now we can go to the sports and art culture questions. Okay. Honorable Deputy Minister of Art or of Sports and Art and Culture, can you please respond to the question number 72 asked by the Honorable DC Christian, but the follow-up question is going to be done by Honorable Paha. Honorable Deputy Minister of Sports.
Thank you very much, House Chair, and good afternoon to honorable members. Thank you very much for the question from Honorable Christians. The response is like this. Yes, the department has undertaken to conduct a national audit of statues, monuments, and memorials. It will be undertaken as part of the presidential employment stimulus package, where about 260 job opportunities will be realized from the project. The agency of the department, known as the South African Heritage Resources Agency, known as SARA, will be implementing the project for the department. The project will start next week. The advert is going out, and it will finish at the end of March 2021. The 260 recruits will be coming from the unemployed graduates who will be employed by the department's agency and will conduct the national audit. SARA has set up a reference group made up of experts in history and heritage to play an advisory role on the audit and towards transforming the heritage landscape. The department will also appoint a steering committee to drive the consultative and implementation process. Public consultative processes will take place before the relocation or repositioning of any monuments. This will be as provisioned by the National Heritage Resources Act number 25 of 1999. Thank you very much, House Chair.
Thanks, Deputy Minister. Honorable Paha.
Thank you, Chairperson, and thank you, DM, for your response. DM, as your department only received a fraction of the COVID-19 budget and is also severely restricted in terms of finances, and considering that there are more pressing issues for your department to consider, such as supporting the livelihoods of sportsmen and women, artists, and people in the acting and entertainment industry. Street signage that hasn't been updated and renewed in years, as well as keeping museums and cultural heritage sites that the removal of the nation's history. How will the project of removal of statues and monuments takes place with no budget at all? Thank you, Chairperson.
Thank you, Honorable Paha. Honorable Minister, Deputy Minister.
Thank you very much, House Chair. And thank you very much, Honorable Paha, for that follow-up. And of course, it is true that budget constraints, not only for us as the department, but the entire government, is something that we are dealing with. But it doesn't mean that issues of social cohesion and nation building must be put at the back burner because of that. We have to find a balance. That's why in my response, Honorable Paha, I have explained that this project will be funded through the Presidential Employment Stimulus Package, which is one of the projects that we have put in place to make sure that, amongst other things, it tries and activates the economy in the country. But also, we believe that we should be looking at these issues not as a reactive way, but more proactive. And therefore, the issue of doing the audit, because at this point in time, we are just doing the audit so that we are able then to take a decision which statue gets to be stored, which one stays, and that decision can only be taken after the audit has been done. Thank you very much, House Chair.
Thank you, Deputy Minister. The next follow-up question is going to be asked by Honorable S.E. Mfaela. Honorable Mfaela. Honorable Mfaela.
Yes, ma'am.
Siyabonga baba.
Honorable Deputy. Yes, ma'am. You hear me?
Can we talk?
Honorable Mfaela, ngicela
Yes, ma'am.
uxolisa kancane. The next follow-up question have asked by Honorable Ayintsube.
Yes, ma'am. Thank you.
Then wena uzoza emva kwakhe.
Yes.
Honorable ngiyabonga baba. Honorable Ntsube. Honorable Ntsube.
Chair, they are not here. These people are not concentrating.
Hayi kahle. Honorable Ntsube.
Chair.
Yes, ma'am. You can ask your
thanks.
follow-up question.
No, thanks, Chair. Let me appreciate the response by the minister. But my follow-up question relates to the apartheid statues and the symbol occupying at the same prime position that they occupied under apartheid. What prevents the department from removing these statues from the public spaces, migrating them to museums like it has been done, use the Hill Road statue from the University of Cape Town? Thank you very much, Honorable Chair.
Thanks, Honorable Ntsube. Honorable Deputy Minister.
Thank you very much, House Chair. And thank you very much, Honorable Ntsube, for that follow-up question. It is indeed true that there would be those feelings amongst the members of the society that we need to remove some of the statues and put them in this place of safety. The reality of the situation is that we can't just decide at our whim as the department that we are removing this statue and not removing this one. That's why it is critical for us that the audit is done first. And then once that audit is done, there is then a process of consultation and also allow the experts in the history and heritage to actually play an advisory role so that when we then decide that which one must be stored, we have done that process. But also it is important for members to also remember that in whatever that we will be doing, at uppermost in our program is to make sure that the issues of social cohesion and nation building will be playing a key role. Thank you very much.
Thanks very much, Deputy Minister. The next follow-up question is going to be asked by Honorable E.S. Mfaela.
Yes, Honorable Chairperson, Honorable Deputy Minister. Actually, I'm partly covered. My question was whether the department has considered the alternative of placing monuments and statues that represent South Africa's hateful past in a history museum.
Take it from me.
In order to preserve the history of our country without brutally offending our people. I thank you.
Honorable Deputy Minister.
Thank you, Honorable House Chair. As Honorable Mfaela says that he is partly covered, it is also important to remember that our history is a painful one, and therefore we will always have to make sure that as we deal with these issues, we also not look at the fact that we need to clean the history totally. Because remember, every country has got a history, whether it's painful. We need to be moving from a history and making sure that reconciliation and nation building is done in such a way that it accommodates everybody. As I've already said, that's one area that we will be very sensitive when we're dealing with this issue. And therefore, as soon as the audit is done and we are able then to, on the advice and on the inputs that would have been done by the people of South Africa, we will then be able to remove those statues and areas that people need us to take away and restore. We will do that, but it cannot be just us as the department deciding which must go and which must stay. Thank you very much.
Thank you, Deputy Minister. The next honorable member is Honorable Mukause to ask the follow-up question.
Deputy Minister, there's no history here. The history which is here, it's a painful history which reminds us how our land was stolen from Black people. So there's nothing to protect. Nonetheless, Deputy Minister, for years we have been calling for the removal of colonial and apartheid statues and monuments in this country. They are offensive, they are harmful, and they are constant reminder of our bloody past, who stand still blind even today. They remind us of the roots of our continued landless, Deputy Minister, and the subjudication in Parliament was surrounded by the statues of these bloody colonial criminals, Queen Victoria, Louis Botha, and John Smarts. Why are there's resistance within this government, the current government, against the removal of these statues, Deputy Minister? What historic and presents value of these monuments honoring killers of Black people does this statue serve, Deputy Minister, except a painful history of a Black landless society which today we are facing in Africa, South Africa and Africa? Thank you.
Thank you very much, Honorable Makause. And I agree with you that our history is a painful one. And therefore, as we move forward to build a better South Africa, we are not going to be able to do it the same way that those that have made our history painful. We also repeat the painful process. Ours is to make sure that we deal with the issue in a manner that it is carrying everybody along. It is making sure that as outcome 14 of the National Development Plan, which talks about social cohesion and nation building, we make sure that we adhere to those. That is why it is going to be important that when this process unfolds and the consultative process takes place of the public then make sure that they participate fully so that all those statues that they want removed, their voice is heard en masse, so that the department is taking what the majority of the people of South Africa says in terms of those that must be removed and those that must stay. I agree that from a subjective point of view, when you look at those statues sometimes, you don't understand why we are not taking a decision. Unfortunately, we can't take a knee-jerk approach on this thing. We have to make sure that we follow due processes. Thank you very much.
Thank you, Deputy Minister. We now come to question number 80 asked by Honorable Gillian. I'm informed that Honorable Nchabeleng will be standing in for Honorable Gillian. Honorable Deputy Minister.
Thank you very much, House Chair. And thank you very much for the question from Honorable Gillian. The response is the Department of Sport, Arts and Culture had made a number of attempts to ensure that it reaches out to entertainers since the beginning of the lockdown to date. It has further actively engaged with its provincial counterparts to heighten efforts of reaching out to their local artists. The following programs were rolled out and others are still underway. From April until for 2 weeks, we called out on application for the first wave of the relief fund, which had taken place, and the second wave was advertised in September. And there's also a partnership between the Department of Sports, Arts and Culture and the Department of Small Business Development for visual artists, crafts, design, and audiovisual arts. There is also a presidential employment stimulus package that I had spoken to. The interventions instituted were not without challenges, House Chair, as they occurred under unfamiliar and rapidly changing circumstances. The sector outcry for opportunities to receive relief is a process that is incrementally being responded to. The effectiveness of each intervention is being evaluated and subsequent improvements are being implemented to complement the interventions. A total evaluation of these and their impact will be undertaken when all have been fully executed and concluded, wherein a complete report will be presented. Thank you very much, House Chair.
Thank you, DM. Honorable Nchabeleng.
Thanks a lot. Thanks, DM, for your response. It is quite detailed and very helpful in helping us to understand where we are now. But I just want to know, has the department considered a possibility of mobilizing the business community, both local and international, with a view to securing assistance for many artists who have not yet benefited from government's relief programs? Thank you.
Thank you, Honorable Nchabeleng. Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Nchabeleng, for the question. The government's approach on dealing with issues of relief is always about, first of all, making sure that there's partnerships within departments themselves. Hence, I even mentioned the fact that we've got one that we are dealing with the Department of Small Business Development, but also private partnership is critical because government or the department on its own cannot be able to do everything. That's why the issue of partnership is very critical. We are looking at our friends that we have a relationship with, which we would be able to, for instance, deal with the issues, particularly amongst the BRICS countries, the G20 countries, to make sure that what is it that we can do to make sure that our artists and athletes are able to benefit from this process. So yes, to finalize the question, Honorable Nchabeleng, we have looked at the issue of partnerships because partnerships are the only way to go. Government cannot be able to do everything by itself.
Thank you,
Thank you very
DM.
much, House Chair.
The next follow-up question is from Honorable Baga. Honorable Baga.
Thank you, Chairperson, and thank you, DM, for your response. DM, in our last meeting as the sports, arts and culture, we had various stakeholders after they had a protest march to the department. Those who participated in the march were voicing their despair on non-payment and or lack of government support in the fight against COVID-19. In a meeting that we had, they stated that CIFSA was a small screen who received money from the department. What steps have been taken by the department to resolve such issues from those had done during the strife with COVID-19? Thank you, Chairperson.
Thank you, Honorable Baga. Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Baga, for the question. I think the first approach is to contrast the two. If you understand the sports sector is better organized than the arts and culture sector in the sense that on the sports side, you have federations. So it becomes easy to interact with the sports bodies through the federations. When you come to the arts and culture side, they are less organized than the sports. So the Creative Cultural Industry Federation of South Africa, CIFSA, was put together to try and mitigate that fact, that you have a structure that you would be able to interact with when you want to deal with issues of arts and culture, that you would have all bodies or structures that are organized for artists being under one umbrella board so that it becomes easier for the department to interact with them. Of course, it has not been an easy road, and we have not reached that thing yet. That's why, as Honorable Bacher puts it, there has been different stakeholders that have come forward complaining. There's also been some protest around this. The department has met with a lot of them to try and resolve the issue. But the big issue is how they should be organized so that it becomes easy for us to interact with them. But in terms of the first wave, Honorable Bacher, for instance, the applications that we had received for people, particularly from the arts and culture side, were around 4,910. And they didn't come from the SIFSA only, they came from across the board of the artists. And to date, we had paid about 4,166 of those. The reason why the number is low is because we had picked up that there were some duplicates. So there were about 744 that were duplicates that we couldn't then pay. But in terms of those that benefited, they are not necessarily coming from SIFSA. It's the artists themselves, whether they are coming from different structures. But the bottom line is that at some point, we need to make sure that they are organized so that it becomes easy to interact with them. Thank you very much, House Chair.
Thank you, Honorable DM. The next follow-up question is from Honorable Moletsane. Honorable Moletsane.
Well said.
Thank you, Chair of the session. Deputy Minister, the qualification criteria for relief funding for artists was very exclusionary, as it focused only on those already established artists who suffered financial loss due to cancellation or postponement of shows. Was any consideration ever made for less established artists who were also hard hit by the lockdown and couldn't access any form of alternative income? Thank you.
Thank you, Honorable Tsane. Honorable DM.
Thank you very much, House Chair. It's true that during the first wave, the qualification criteria was a bit tight because at the time we looked at those artists that would have had some events that they would have performed, and the criteria needed them to bring a letter that shows cancellation, and it did not even included those that would have had postponement. But as I have said, we learn as we move. So when we then took a decision to implement the second wave's criteria then was much better than the first wave, because we then looked at what went wrong during the first wave. So the second wave's criteria was more relaxed. It didn't have those exclusionary areas. We made sure that, for instance, if you had an event, if you can't get the promoter, get somebody who is even within the industry to actually write you a letter and you submit. We also made sure that you can submit your application through a WhatsApp. We also made sure that, because I don't know if Honorable Muletsane remembers that there was also a problem of people that were saying some of them, they are freelancers, and that criteria was not accommodating them. The second wave made sure specifically that even the freelancers were accommodated. So yes, the first wave was a bit tight, but the second wave criteria was more accommodating. Thank you so much.
Thank you, DM. The last supplementary on this question is from Honorable Dutoit. Honorable Dutoit.
Thank you, Honorable Chair. Honorable Deputy Minister, does the Department of Sports, Arts and Culture have any reserve funds to compensate beneficiaries should harsher lockdown levels be imposed if another wave of infections takes place? If yes, how much?
Thank you, Honorable Detroit. Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Detroit. You will remember that when we announced the first wave, we announced an amount of about 150 million, which was taken from the events that the department wouldn't be able to perform due to lockdown. So there was no new money that came from anywhere. The department looked at those programs that we wouldn't do, and we put those funds together, and we came up with about 150 million. And what happened is that at the end of the first wave, when we realized that we had used about 80 million and we still had some surplus that was left, we then announced the second wave. Now, the second wave is not complete yet. It is still in progress. It is, and we also are aware that when the Minister of Finance announced on the adjustment budgets, a lot of departments were affected with the reduction of budgets, particularly the Department of Sports, Arts and Culture. So it's going to be very difficult for me now here to say there is an excess fund somewhere that we will have in the event that there is a second wave. It will be a process where the department would have to sit down and look on how to move forward if there is a need for us to have a call for a third wave. At this point in time, we are completing the second wave. Thank you very much, House Chair.
Thank you, Honorable DM. Honorable DM, we now come to question number 66, asked by Honorable Mfaela. Honorable DM.
Thank you very much, House Chair, and thank you very much to Honorable Mfaela for the question. We respond like this: the department is unable to confirm whether it will support the KwaZulu-Natal Entertainment Awards at this point in time. Due to the national lockdown regulations, all Mzansi Golden Economy open call proposals have been cancelled, and some of the Mzansi Golden Economy budget was reprioritized to address the relief efforts related to COVID-19. Further to this, the budget was further reduced during the national budget adjustment. So the department has since publicly communicated with potential applicants that they would have to reapply in the new financial year, and the new call for application is scheduled to open at the end of November 2020. But having said that, the awards themselves are very important generally in the life of any arts practitioner, because being awarded presents a potential for upward trajectory in one's career. It opens new opportunities and is an acknowledgement of one's excellence in the arts. So to that extent, the department does not perceive as a waste of resources, but a crucial process in the growth path of emerging and developed artists when you have awards. So as indicated above, the use of departmental funds towards these ceremonies is already seen as a means of improving the lives of arts practitioners. Thank you very much, House Chair.
Thank you, DM. The first follow-up will be from Honorable Mfaela. Honorable Mfaela.
Honorable Chairperson, Honorable Deputy Minister, my follow-up question is that what allocated budget for this project and who is meant to benefit from the project? The second one was, how does the department intend to practice transparency to prevent any fraud and corruption with the funding? I thank you, sir.
Thank you, Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Mfaela, for the follow-up question. As I have already explained, I think maybe I must explain that this KwaZulu-Natal Entertainment Awards is not a government program. It would have been some NGO or a company that would have wanted to host the awards to apply for assistance in the funding. So as I've always explained that as the department, due to the lockdown, we have since cancelled all the Mzansi Golden Economy Open Call proposals. And we will only be opening for new calls in November 2020. So at this point in time, we have not allocated any budget on this project. We don't even know if we will allocate any budget on this project, because at this point in time, we are not allocating anything yet, because we are only waiting for the proposals that would come once we open in November 2020. Thank you very much.
Thank you, Honorable Chair, Honorable TM. The second supplementary follow-up question is from Honorable Lutuli. Honorable Lutuli.
Thank you, Chairperson. And DM, everyone is aware that we as economic freedom fighters are in support of giving back to the industry. And we are the only political party that made sure that the artists got something during the lockdown in order for them to put food on the table. And understanding to your reply that there is nothing that says that you will fund this ceremony. But in case you do, because as we are saying that the program is some NGO that will ask funding from the government, what guarantees would you give that this award ceremony will benefit the artist and the industry at large, and that the money will not be mismanaged and looted as is the case with all the funding? Thank you.
Thank you, Honorable Tuli. Honorable DM.
Thank you very much, Honorable Lutuli, for that follow-up question. Just to say that the economic freedom fighters, they had assisted some artists, and we really appreciate that. But we also want to make sure that they are not the only organization that did that. As I have already indicated, that the Department of Sports, Arts and Culture had about 4,910 artists that have been allocated, and out of those, 4,166 were given the relief. The reason for the number to be low is because there was duplication of applications, which was about 744. So I'm sure, Honorable Lutuli, you would agree with me that those that you had funded as the economic freedom fighters don't even get to 2,000. And I'm talking to you about 4,000 plus that we had funded as this department. But nonetheless, we appreciate the work that you have done, but it doesn't negate the work that has been done by this government, led by this
Yes.
Thank you, Honorable DM. The third supplementary question is from Honorable Ndongeni. Honorable Ndongeni.
Thank you, Chair. DM.
Yes, yes.
Thank you for the replies you give us. DM, whether the department has done an audit in terms of the success of COVID-19 relief funds set aside for artists across South Africa, how many artists benefited from the scheme, and how many are earmarked to benefit moving forward?
Thank you, Honorable Ndongeni. Honorable DM.
Thank you very much, Honorable House Chair, and thank you very much, Honorable Ndongeni, for that question. Quickly, I have already explained on the first wave that the people that have benefited are 4,166. But I also want to explain that above that, there were about 417 applications that were of digital in nature, those that would have then assisted in making sure that there is work that would be done online. And those applications were about 417, and we had paid all of them. And then there was also a program of living legends, those that would have been old enough not to be able to benefit because some of them are getting some kind of social grant. But what we then did is to make sure that they are paired up with some young people to do some work. And those living legends were about 138 in total. that came from all the 9 provinces. So that's what we had done during the first wave. As I have already explained that we are busy with the second wave now. The second wave is that at this point in time, we had received about 2,702 applications, which are being handled by 2 entities of the department, the Business Arts of South Africa and the National Arts Council. So that process of now making sure that they are being adjudicated and being paid is in progress. Secondly, from the Solidarity Fund, we had received.
Yeah, protected DM, continue.
From the Solidarity
order.
Who's calling a point of order?
It's Rada calling a point of order, please, Mr. Nyambi.
Honorable Rada.
Thank you. Can the Deputy Minister just clarify that number, please? The way she said it was unclear if it was 200,000 or 2,000.
2,702. 2702.
You can continue, DM.
Thank you very much. And we had received from the Solidarity Fund food vouchers, which were up to 7,000. So what we had done is to divide those food vouchers per province and allocate each province how many they can have. We've got the breakdown. We can submit it if members so needs, but at this point in time, we ended up exceeding the 7,000. We had about 7,533 that we had to give to the people. And the last part is that I don't know if members saw 2 days ago, an advert has gone out on the partnership between us, the Department of Sports, Arts and Culture, and the Department of Small Business Development, calling for applications to assist those that are in the crafts and in the art. So that's more or less what we have done. Obviously, in terms of then making an audit of how many would have benefited, that process can only be taken once this whole process is done, so that we can be able to give a roundup number of how many artists and athletes have benefited at the end. Thank you very much, House Chair.
Thank you, DM. The fourth supplementary question is from Honorable Browdenset. Honorable Browdenset.
Thank you, Jay. Honorable Deputy Minister, thank you very much for your response, which I'm very glad to say displays a certain measure of responsibility in terms of funds and COVID spread. If we can just go back to the proposed event, though, Deputy Minister, it appears that it is being mooted to be held at the ICC, International Conference Centre in Durban. And being a past eThekwini councillor myself, I know that the eThekwini municipality is very fond of lavish award ceremonies. I think you would agree that such a ceremony would be a complete waste of money, and the money should either be spent on South Africans or on South African artists, and also that such an event would be a super spreader of COVID-19. So are you prepared here and now, Deputy Minister, to issue a note of caution to the eThekwini municipality that they should not waste any money on such an event, and that such an event would also be a super spreader of the COVID virus? That they should abstain from holding such an event for now. Thank you.
Thank you, Honorable Browdenset. Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Browdenset, for that follow-up question. As I have already explained, as the National Department of Sports, Arts and Culture, we are not funding any event right now until such time that call for proposals is opened in November, and therefore we would then see who then applies to the department and who doesn't. But having said that, I also want to make sure that we also understand that the South African government has got 3 phases of governance, which each of them have got their own responsibilities. And of course, The important writing factor here is that there has to be some intergovernmental relationship on the three spheres of government. Having listened to Honorable Council that this is an event that is normally held by the municipality, eThekwini municipality, and it is normally held in ICC. I'm not aware of it, but obviously we are all as government cautious of the fact that at this point in time, we make sure that whatever rands and cents that we have are there for the people of South Africa. As we mitigate and look at what we make sure that the economy is revived in the country, the important thing is that if that event is to take place, we have to evaluate what effect and who benefits and what is it going to assist those that would have performed in it. Thank you very much, House Chair.
Thank you, DM. Honorable DM, we now come to question 5-6 asked by Honorable Arnold. Honorable DM.
Thank you very much, House Chair. The question is asked by Honorable Arnold, and the response is that we note the limited funding for this area of work. The department has placed intervention measures in place to address equitable participation in sport and development of sporting codes, especially for the underprivileged. To ensure equitable participation in sport development, the department has taken a conscious decision to work together with all spheres of government, sporting bodies, and other relevant stakeholders. Through the mass participation and sport development conditional grant with all provinces, we strive to increase and sustain participation in sport and active recreation, of course, and also we improve sector capacity to deliver sport and active recreation. Development of sport codes is done through the following programs using the conditional grant funds. 1, school sport. There are 16 priority codes that is focused on the school sport with a view to increase access to participation and increase participating opportunities in sport. Through school sport, the department aims to achieve the following outcomes. Increase the number of learners supported to participate in the National School Sport Championships. Increase the participation of learners participating in provincial and district school sport tournaments. Increase the provision of equipment and or attire to schools. Support school sport structures and create employment through employing school sport coordinators. In active recreation, we implement provision of equipment and attire to hubs and clubs and community sport coordinators employed to run programs in communities. There's also club development where we support local leagues as organized by federations. But to bridge the gap, a scientific support from sport academies is implemented. Athletes are supported by these sport academies. Now, in addressing the underprivileged, the Department of Sports, Arts and Culture is continuing to build good facilities through the Municipality Infrastructure Grant in villages in our country. The completed facilities sometimes are handed over by the minister or myself over to the communities. But there is a rural sport development program known as RSDP, which was launched in 2016. It has been conceptualized out of a realization that notwithstanding the efforts made by government to promote sport in the country, most disadvantaged communities, particularly in the rural areas and areas under traditional leadership, still require a structured, focused sport development program and facilities. The Rural Sport Development Program is therefore one such program aimed at uplifting sport in the rural as well as farming communities. The federations receive funding specifically earmarked for sport development. The department funds the qualifying national federations according to the financial and non-financial support policy. Funding will be provided across 2 tiers. 1, guaranteed funding and conditional funding, which will constitute the bulk of the funding that will address issues of governance, transformation, and performance. Amongst the varied athlete support programs provided is the Ministerial Sports Bursary, which is traditionally awarded to learners from grade 8 until they complete their high school education. The bursary recipients are identified through the school sport program and placed in the sport-focused schools in order to give them opportunities to learn and improve sport-specific skills whilst being supported academically. But lastly, the department works with its partners, Sport for Social Change Network and Love Life, to roll out programs in communities to promote active and healthy lifestyles in order to combat the social ills that plague our society. Thank you very much, House Chair.
Thank you, TM. Honorable Arnold.
Thank you, Chairperson, and thank you to the Deputy Minister for the response on my question. Deputy Minister, when building an active nation, it is clear that no country can expect to achieve and sustain success at an elite level. There must be a strong participation based in local communities because that is where every champion has their beginning. Equitable participation in sports also means that sporting codes must split the budget between female and male teams, starting from Banyana Banyana and Bafana Bafana. The legislative authority to oversee the development and management of sports and recreation in South Africa, the Constitution affirms the democratic values of human dignity, equality, and freedom. Are there any targeted talent identification processes in place to enable the identification of athletes from previously disadvantaged communities? And if the answer is yes, what are the details? Thank you, Chairperson.
Thank you, Honorable TM.
Thank you very much, House Chair, and thank you very much, Honorable Arnold, for that follow-up. And it is very true that you are not going to have a winning nation because winning nation is the elite sport. You are not going to have a winning nation if active nation is not adequately funded and making sure that it feeds into the winning nation. And that is very true. But there are two things that Honorable Arnold raises. One is the issue of the federations funding the male and female teams. And we want to agree that this is one area that concerns us as the department. As a result, particularly around the issue of the elite, which is the winning nation. When you look at Banyana Banyana and Bafana Bafana, when you look at Proteas, women cricket and Proteas, male cricket, and others. And even when you look at rugby, the women's rugby and the male rugby. Now, the department we are in the process of a women's sport policy, Honorable Arnold, that we hope that we will be able to unveil and launch by the end of March 2021. We have done consultations with all the provinces. We had finished the beginning of this end of last month. We were finishing the last province, which is Northern Cape. So we've done all 9 provinces now. We are going to release the draft policy to make sure that at the end, the issue of women and male athletes is being looked at equally. The second part, Honorable Arnold, I don't know if you know, there is a group called Eminent Persons Group, which amongst other things, it looks at federations and how they are dealing with the issues of transformation. And they release their report annually. And the minister then would talk to this report and look at those federations that are not complying with the issues of transformation. It's a very important report. And I would love that at some point, honorable members acquaint themselves with that report because it talks to the areas that we are always concerned about. as the nation. But lastly, as I have said, the bursary that the department has, which identifies promising athletes at high school, which would then be given a bursary identified by the coaches and the federation themselves. And those students will be then taken to the elite schools where the sport is primary. And that helps them to be able to transcend, to be able to be recognized and be able to play at the elite sport. It is not enough, Honorable Arnold. We can't say this is enough. More could be done to make sure that the issue of transformation of sport is done more than it should. And we are happy that we could provide that kind of numbers at this point in time to say how many have been given bursaries and how many have been taken to the elite schools. Thank you very much, Honorable House Chair.
Thank you, Honorable DM. The second follow-up question is from Honorable Dutoit. Honorable DM. Honorable Dutoit.
Thank you, Honorable Chair. Deputy Minister, the initial question speaks to the National Sports and Recreation Plan. And I'm quoting the August 2012 NSR plan, open quote. At the heart of the NSRP is a transformation charter and a multidimensional transformation performance scorecard. The purpose of the charter is to transform the delivery of sport in South Africa. It refers to equal opportunity, fairness, and just behavior, equitable resource distribution, empowerment, and information, close quote. So the mission of the NSR plan is to, open quote, to transform the delivery of sport and recreation by ensuring equitable access, development, and excellence at all levels of participation to harness the socio-economic contributors that can create a better life for all South Africans, close quote. It also describes equitability as follows. Every individual should have an equal opportunity to make for him and herself the life that he or she is able and wishes to have, consistent with his or her duties and obligation as a member of society, without being hindered in or prevented from doing so by discriminatory practices. Equitable treatment is a fundamental value of all participating in sport, close quote. Minister, with intervention measures such as quotas that force representation in different races in sports, would you agree that some athletes are deprived from reaching their full potential because they are replaced on the basis of race and not merit? Thank you, Chair.
Thank you, Honorable Dutoit. Honorable DM.
Thank you very much, Honorable House Chair. And thank you very much, Honorable Dutoit, for the question. And thank you very much for your understanding of what the National Sport Recreation Plan seeks to achieve. And I hope you will also remember that it was put in place specifically because at that point in time, there were a majority of South Africans which were not necessarily being represented in the sports. And therefore, the plan was trying to level the playing field to make sure that every South African has got equal access, either and whether it is in rugby, cricket, athletes, and everything. And of course, Honorable Tutoy, you can put documents in place, you can put plans in place, but one of the things that unfortunately you have to be conscious about when you're dealing with issues of transformation is to make sure that you actually try to make sure that you bring everybody. You make sure that even those that necessarily don't believe on this transformation actually understand the importance of it. Because at the end of the day, sport is important in making sure that we build a social cohesive nation, but also we build we make sure that there is a unity in South Africa. Now, the plan could be there, but if the people that had to implement the plan are not able or willing to implement the plan, government had to make sure that it puts systems in place. So the quotas were one area of making sure that as we move towards this plan to make sure that everybody ultimately will have equal opportunity. But in the meantime, let's make sure that we start by making sure that those that were disadvantaged, that did not have the access now that has been put in place by making sure that the quotas are working for them to make sure that they become a part of the mainstream of sport. It is not enough because those quotas still don't give a majority of the previously disadvantaged to be able to be in the mainstream of the sport. But it is a good way in the right direction. But ultimately, we would want to see a situation where we don't even use quotas anymore. Everybody gets in there by merit and make sure that every South African, whether they come from Ezans, or they come from Elimpopo, those people bazawukwazi ukungena babe part of the elite sport, not because they don't have the opportunity to do that, but the processes that have been put by government and this national sports recreation plan has made it possible for everybody to have that access. Thank you very much.
Thank you, Honorable DM. The third follow-up question is from Honorable Boshoff. Honorable Boshoff.
Thank you very much, House Chair. Good afternoon to you, DM. I heard you speak of wanting or looking at increasing participation of learners in the sporting fields. In view of this, I'd like to ask you, how is SASCOC intending to address the issues of school sports when there are matters related to the CSA where there is resistance to table the annual and financial report? And how is sport going to be central in our country if sporting codes are not at ease with SASCOC? Thank you, House Chair.
Thank you, Honorable Boshoff. Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Boshoff, for that question. One thing that we must all acknowledge is the fact that SASCOC, which was put together to make sure that all the sport federations in the country are all under the umbrella of SASCOC. And therefore, the importance of making sure that federations adhere to what would then help young people through the federations making sure that they are implementing their transformation programs. Yes, SASCOC is having its own challenges, Honorable Boshoff, and I hope you know by now that they are going to their quadrennial Congress this coming weekend on the 7th, and with the new leadership that would emerge there, one hopes that there will be new energy and of making sure that they deal with the issues of sport and the issues of making sure that young people have got all the opportunities of participating in the sport. But also, I think for me, it's going to be very important as well to say, SASCOC, with all its challenges, the issue of school sport is an issue that is still a very critical area, because you will remember that we don't have the full control of the school sport as the Department of Sports, Arts and Culture. Remember, the Department of Basic Education is still in control of that. That's why we had to get into a memorandum of understanding with the Department of Basic Education to try and level the playing field around the issues of school sport. It's an area that we're working on, because whilst we are putting funding there, but at the end of the day, what happens in the school premises doesn't lie with SASCOC, doesn't lie with the Department of Sports, Arts and Culture. It squarely lies with the Department of Basic Education. Thank you very much.
Thank you, Honorable DM. The fourth follow-up question is from Honorable Nsube. Honorable Nsube.
Thanks, House Chair, and welcome back. Thank you very much, Deputy Minister.
Thank you.
We want to check from your department, what is the level of commitment on part of department to streamline indigenous South African games and to promote them to the rest of the universe. Dibeke, Ntimo, Khati, Diketo, Intonga, Murula, le Morabaraba, jwalo jwalo. Thank you very much, Deputy Minister.
Thank you, Honorable Nsube. Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Nsube, for that question. Ndinethemba loba amalungu ayazazi uba zintoni ezi-indigenous games. Abanye benu xa bekhula sathi nanizidlala iintonga, oophuca, oogqaphu, zizo ezathetha ngazo Honorable Nsube i-indigenous games. I-department ke ixabise kakhulu le midlalo kangento yobana kaloku ukusukela ngo-2003 kwakunento kwakusithiwa yiBasotho Cultural Village phaya eFree State, Honorable Nsube, apho zaqala khona udlala. Kodwa safumanisa into yobana kuzawubaluleka kuba siyi-department siqinisekise into yoba zonke ii-province ziyayidlala le midlalo. So into eyenzekayo ngoku nasezikolweni seyidlalwa le midlalo, siqinisekise into yoba eminye yayo izawukwazi ukuba idlalwe at national level. Senzela ke into yobana nikhumbule into yoba le midlalo ihamba ncakasana nokuthi singobani, sisuka phi, and iqinisekise into yobana sikhumbule ngawo wonke amaxesha into yoba le midlalo ayikho mincane kuba sibona lena idlalwa kakhulu ibukelwa nakoomabonakude ibe lena ingabukelwa koomabonakude. Isebe ke lidibene nee-provinces lineprogram yokuqinisekisa into yoba ezi games ke ziba structured. Andazi noba niyazi na into yokokuba qho ngoSeptemba, kuba uSeptemba inyanga yamagugu, siba nayo le program yezi indigenous games. Iye iqale a day before the Heritage Day, zidlala i-5 days. Iminyaka emithathu edlulileyo iLimpopo phaya eSishirho yiyo ebihoste ezi games. Kodwa nangona bezihostwe iLimpopo, iKwaZulu Natal iziwinile ezi games iminyaka emithathu ilandelelana. Kangento yoba savumelana into yobana mayikhe ihambe ngoku le midlalo imke
kunjalo
ikhe iyodlalwa naphaa KwaZulu Natal kuba kaloku kudala beyiwini. Ngelishwa ke wafika ke ubhubhane oyicorona, asakwazi ke kuyidlala kulo nyaka. Sinethemba ke into yoba kulo nyaka uzayo iyawudlalwa kwaye iyawudlalwa phaya KwaZulu Natal ngeminyaka emithathu izayo. Into endifuna ke ukuyithetha kuni yinto yoba ngaphandle kokuba siyidlala kuzwelonke, enye into esiyenzileyo yinto yoba iSouth Africa ililungu lombutho ekuthiwa yi-Association of International Sport for All, TAFISA ngamanye amazwi. Lo mbutho ke ngumbutho ojongene nezi indigenous games. ISouth Africa ke idlalile ngo-2008 le midlalo iseLithuania, ngo-2012 yaba seSouth Korea, ngo-2016 yaba se-Indonesia. Sinethemba ke lokuba emva kwalo bhubhane xa izawuphinda ibe kwelinye ilizwe, iSouth Africa iyawuhamba iyosimela apho. Sifuna ukutsho ke nokuthi ngoku besinayo ngo-2019 phaya eSishirho besinamazwe amabini ebezile ezobukela, ezojonga into yoba zinto zini anokuthi nawo azifunde kule midlalo yaseMzantsi Afrika. Besinalo iqela ebelibuya eNgilani, sinalo neqela ebelibuya eIndia. Le midlalo wena ibalulekile kwaye sinethemba loba amalungu xa ikhona la Indigenous Games Festival nize, kuba mnandi phaa. Siba nayo nemiqombothi, kubekho into engathi yicarnival, kwenzela uba abantu bayibone into yoba le midlalo ihamba nenkcubeko. Ndiyabulela.
Thank you, DM.
Minister.
Honorable DM, we now come to question 7.3, asked by Honorable Christian. I'm informed that Honorable Bacha will be standing in for Honorable Christian. Honorable DM.
Thank you very much, Honorable House Chair, and thank you very much, Honorable Christian, for the question, which will be followed up by Honorable Bacha. The Department of Sport, Arts and Culture has, in its first wave, that was open to the public for applications, included a category for digital proposals. This is a category that took to consideration the limitations that the lockdown presented in terms of public gatherings and number of clientele that could attend any arts culture sector events. With this mode of presentation, productions had a likelihood to reach even greater numbers than possible with physical events. 417 such applications were approved for funding. The outcome of the applications were made public through the departmental website, and the applicants have provided their publicity posters, which have been shared through WhatsApp platforms and groups. It is accepted that more can still be done going forward. All relief interventions by the department were financial in nature. The first wave provided the applicants with funding of between 10 to 20,000 for loss of income and up to 75,000 for the digital applications. The second wave has been set at 6,600 for all approved applications in the performing arts. Further to this, there are two more streams that the department will be rolling out. That is the Department of Small Business Development Partnership for the visual arts, design, crafts, and audiovisual subsectors, and the presidential stimulus package, which has been broken into two work streams as follows. The first work stream is a public employment work stream, and the second work stream is an employment creation initiative for artists, creatives, cultural workers, and sport and recreation practitioners that support their outputs. This includes support to innovation in digitization, efforts for content creation, and the dissemination and development of e-commerce systems. This objective will be implemented through an open call workstream done through the Department of Sport, Arts and Cultures agencies and associated institutions. Thank you very much, House Chair.
Thank you, DM. Honorable Bacher.
Thank you, Chairperson, and thank you, DM, for your response. But what impact has COVID-19 had on staffing in museums and heritage sites, and what will the long-term implications on keeping museums open be? Thank you, Chair.
Thank you, Honorable Bacher. Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Bacher. Museums have been severely affected by the COVID-19 pandemic. You all know generally that when it comes to sports, arts, and culture, you need people to gather, you need people to visit, you need people to go and be able to go there. Because of the lockdown regulations, this had a very negative impact on these areas. And therefore, it has also affected the employment of the people in this area. That's why one of the areas that we're trying to make sure that we deal with is the issue of making sure that when it comes to the programs, the economic programs that the government has put in place, this area of sport, arts, and culture is looked at. Because what we have identified is that it is important to note that when it comes to the creative economy, if it is totally looked at and you are able to look at what it can bring to the country and look at what needs to be done to make sure that whilst other economies are being affected, this area can be able to mitigate for the country. That's why we are putting together a program to make sure that when it comes to issues of creative economy, all of us were able to participate and interact and put our, even our views on what can be done better to make sure that this economy is one of the economies that South African government looked at in terms of reviving. Thank you very much.
Thank you, DM. The second follow-up question is from Honorable Nchabeleng. Honorable Nchabeleng. Honorable Nchabeleng, it seems is covered. We'll go to the next.
No, I'm here.
Question.
I'm here,
upside down wherever he's seated.
You must be very alert, Honorable Nchabeleng. You are recognized.
Yeah. No, thanks, Chairperson. It's for a long time. the sector has not been seen as a priority for career choices. And as a result, many artists, especially young people, do not have the opportunity to have their talent identified and developed at school level. Are there any plans by the department to reposition the arts, culture, and heritage sector as an economic growth sector and to introduce programs that will integrate the sector at the core of our education system? Thank you, Chairperson, and thanks for the disturbance in the background. Sorry for the disturbance in the background.
Okay. Apology accepted. Honorable DM.
Thank you very much, House Chair, and thank you very much, Honorable Ntlalebeleg, for the question. The department is currently providing bursaries for arts practitioners through the National Arts Council for the arts and culture sector. But furthermore, the department also provides more than 300 language bursaries per year to deserving students, which is managed by 6 universities throughout the country. And we also provide about 66 heritage bursaries per year. The department also established the Artist in School program in all 9 provinces to provide practical support to teachers augmenting the theory in the CAP syllabus. These are all the programs aimed at integrating the creative industry across all domains into the core of the education system. But of course, we are aware that this could not be enough. More could be looked at, and we make sure that we can do more around this area. Thank you very much.
Thank you, ROTM. The third follow-up question is from
to the arts industry to fund projects and events, specifically for those less privileged arts practitioners in townships and rural areas that could assist in the economic recovery of the sector, as well as create employment opportunities for those who lost their jobs. Thank you.
Thank you, Honorable Mletsane. Honorable DM.
Thank you very much, Honorable House Chair, and thank you very much, Honorable Mletsane. It is true that the entertainment industry is the one that is hard hit around the issue of the COVID-19 because, unfortunately, it depends on people gathering. And at this point in time, the limitation on the gatherings is affecting the entertainment industry. And also because the government had to make sure that it balances, saving lives and make sure that we're building up livelihoods. Now, as I have explained earlier on, the department, together with the Department of Small Business Development, we had put a program in place to make sure that particularly the arts people on the creative sector are able to access the funding to be able to build up their small businesses. 2 days ago, which is on the 2nd of November, the advert went out, the applications went out for artists to apply for that funding to make sure that they will be able to get into it and make sure that they are able to build on their small business. But secondly, remember, I have also explained that through the Presidential Stimulus Package program, we have also motivated as the department that the artists must not be left out of it. And therefore, that's why there is 2 streams there. One is the streams of making sure that there is job creations, but also retaining those jobs that would have normally have been lost to make sure that you are able to save those jobs. But more than that, I have also explained throughout that the digital funding, which was made available to about 517 organizations or individuals to make sure that there will be digital mainstreaming of events, to make sure that whilst we cannot gather, but at least there would be a way of making sure that some kind of entertainment goes on and artists will be able to earn some kind of money. And yes, long term, we would need to look at what can be done beyond this. Because remember, COVID has given the department an opportunity to now sit down and look at long-term plans of how then do we make sure that we assist our artists and make sure that we are able to help them, not just on short-term, but on long-term plans. Thank you very much.
Thank you, Honorable DM. The fourth follow-up question is from Honorable Mfaela. Honorable Mfaela.
Honorable Chairperson, Honorable Deputy Minister, I want to know whether the department has considered implementing some best practices around the globe, such as the introduction of a virtual visit to our cultural sites. I thank you, sir.
Thank you, Honorable Mfaela. Honorable DM.
Thank you very much, Honorable House Chair, and thank you very much, Honorable Mfaela. Yes, the department is looking at this area of the virtual visit, but it is still on a limited scale. We need to look at making sure that it gets broader and make sure that, you know, because what the developed countries have been able to do around this area is massive, and we need to learn from best practices and make sure that we also go that route so that we don't allow this area of work to die because people cannot physically visit. So it is one area that we're looking at. At this point in time, it is implemented in a very limited scale, but we're hoping that in the next financial year, we will be able to do it in a more bigger scale. Thank you very much, Honorable Mfaela.
Thank you, Honorable DM. Honorable DM, we now come to question number 82, asked by Honorable Ndongeni. Honorable DM.
Thank you very much, Honorable House Chair. And thank you very much, Honorable Ndongeni, for the question. The response is that in South Africa, December is dedicated to inter alia the Reconciliation Month. This is because the Department of Sports, Arts and Culture is responsible for the 6 national days in the calendar, including the Reconciliation Day. Fortunately, the question emerges as the department is in the middle of preparing for Reconciliation Month 2020. Ironically, the recent incidents and outbursts on what has now been termed farm murders is an indication of how unreconciled we still are as a nation. The march by farmers in Cape Town on the 25th of October 2020 is a further indication to this. It somehow resembled the Black March two years ago in Pretoria. Reconciliation is a deep and detailed process or a journey. Some may even venture into asking the question, how can people be reconciled if they were never friends in the first place, if they have never had a relationship? Reconciliation is deep as it requires truth, honesty, trust, and justice, something that we might not have explored extensively and exhaustively in South Africa. Hence the sporadic spates of eruptions of incidences of racism. There has to be a realization that these outbursts and incidences occur in government offices, not in government offices, but in communities where people are meant to live side by side, harmoniously despite their differences. It is the responsibility of all people living in South Africa to prevent hate crimes, to avoid divisions and promote inclusion and unity. The United Nations Development Programme in South Africa and the Department of Sport, Arts and Culture launched a partnership agreement which aims to intensify efforts to strengthen national social cohesion programs. In this connection, the 2 entities signed a project document, which is the basis of the partnership agreement and guides the collaboration to facilitate integration and promotion of social cohesion for South Africa. The Social Cohesion Project is a long-term nation-building initiative. It is informed by a recognition that the promotion of social cohesion is an important part in nation building and the articulation of South Africa's national identity. The project is an outcome of analysis and deliberations on critical social trends as the country transitioned from apartheid to a non-racialized democracy. The project will focus on strengthening capacities of stakeholders at national, provincial, and local governments, strengthen early warning systems to anticipate and possibly prevent violence and social unrest, and advance social dialogue between key stakeholders to strengthen relationships, improve understanding, and involve communities to align local solutions with national priorities. Regarding the matter of Senegal in Free State, the Office of the Premier has been conducted in relation to a proposed creative community engagement to promote and foster social cohesion and peace amongst Senegal community. The Free State Provincial Department of Sports, Arts and Culture and Recreation has also been consulted on the same matter. We were, however, advised that tensions were still too high for any community engagement to be held, and that the Department of Sports, Arts and Culture will be notified as soon as the security cluster declares the area safe for interracial engagement. We will also continue with the programs of National Days in the province as a vehicle to promote social cohesion and nation building. Our colleagues and partners, such as the social cohesion advocates, will continue with the program of creating platforms for advancing social cohesion and nation building. The moral regeneration movement programs will also pull through with the department in promoting, amongst others, positive values. Thank you very much, House Chair.
Thank you, our DM, Honorable Dongeni.
Gama lamakhosikazi.
Aliyepe.
Honorable Dongeni.
Enkosi sihlalo. DM sicela isimemo kwi-indigenous games. Nje ithe ungasima ngoba utheka manje. Macela ke siye kwi-question ke DM. Thank you, DM, for your detailed response in this important question of reconciliation and racial unity. It is clear, DM, that we have not been able as a country to adequately deal with issues relating to reconciliation and social cohesion. What room is there for the department to establish countrywide awareness campaign using the arts as an instrument like we did in the fight against apartheid? Ndiyabulela, Sekela Mphathiswa.
Thank you, Honorable Dongeni. Honorable DM.
Thank you very much, Honorable House Chair. Thank you very much, Honorable Dongeni, for that question. I think, first of all, the government led by the African National Congress had identified the fact that we cannot assume that we are a united nation just because we had voted and therefore we think that where we come from has just disappeared. That's why when the National Development Plan was put together, Outcome 14 of the National Development Plan talks about the issue of social cohesion and nation building. And it's the responsibility of this department to deal with those. Now, when you talk social cohesion and nation building, it is also important to also realize that it comes from individuals themselves first to understand that they have a role to make sure that they actually build a better South Africa. Each and every one of us, we have a responsibility and a role to make sure that we actually build this country not only for ourselves, even for our future generations. We've got that duty, and we had to make sure that we don't fail in that. Now, it is a long-term journey. It is not going to happen overnight. And therefore, arts and culture and sport, which then becomes the department that I am deployed with, is Department of Sports, Arts and Culture, have got a very critical role to play in this area of social cohesion and nation building. You will remember when the Springboks came back and had won the World Cup. Even in our corners and divisive way, we came together to celebrate the success of the Springboks. And for a moment, there was hope for this country because we saw the kind of a South Africa that we wanted. When all of us were out there celebrating the sprinkles, black and white, happy that we have won the World Cup. And we had hoped that for the moment that we would be able to sustain that social cohesion and make sure that we build on it. But also, whilst we were sitting in the lockdown, some of us, in our corners, we saw what Master KG's song, Jerusalem, has done to the world, which is a song, which is a gospel song, but with a very apt rhythm. Everybody in their corners in the world were dancing to this song because for some moment, it actually united people to make sure that we are all the same. So, Honorable Ndongeni, arts, sports, arts, and culture are very central in making sure that we build social cohesion, we build nation building. And all of us, we need to make sure and understand that even at the localities, in the municipalities, in the provinces, when we understand the role that this department can do, it is not just about playing sport, it is not just about arts and culture, but the fundamental role is to make sure that nation building and social cohesion is central to whatever we do. Thank you very much.
Thank you, Honorable DM. The second follow-up question is from Honorable. Thank you, members. The second follow-up question is from Honorable Klute. Honorable Klute.
Chairperson, thank you, Deputy Minister. We should also remember that this partnership with the United Nations Development Program will bring a lot of investment. I think they talk about 30 investment opportunities. Now, I'll get back to that in a while. When we speak about social cohesion and reconciliation, we need to get back to the one document that's important to all of us, and that's the Constitution. And I would like to again read, and I know many of us has read the preamble to the Constitution. We all know the start. We, the people of South Africa, goes on to say, we believe that South Africa belongs to all who live in it. Not we are welcome. It belongs to all who live in it, united in our diversity. Then it goes on to state, we therefore, through our freely elected representatives, adopt this Constitution as the supreme law of the Republic, so as to, and it mentions, lay the foundations for a democratic and open society in which government is based on the will of the people and every citizen is equally protected by the law. And then also it says, improve the quality of life of all citizens and free the potential of each person. Now, considering that we are looking at huge investment opportunities, Deputy Minister, I would like to ask you, do you honestly believe, I'm not asking whether your party has got the correct policy. I'm asking you, do you honestly believe that by racially based policies such as affirmative action and BEE and BEE, that social cohesion is improved in South Africa?
Thank you, Honorable Klute. Honorable DM.
Thank you very much, Honorable House Chair, and thank you very much, Honorable Klute, for that question. And thank you very much for quoting the Constitution, which is the universal document for all of us in South Africa. But I just wanted to also remind you that South Africa belongs to all of us, black and white, and not just in diversity, but all of us, black and white. And that is important that when we go to the Constitution, we remember that it covers all of us. And and I'm happy that you started there, because we are on the same footing in terms of understanding where we're going. Now, your question is to me, it's a subjective question. Do I believe in affirmative action and the BEE? And you want to divorce my belief to my organization, which is the African National Congress. Now, I am a Deputy Minister for Sports, Arts and Culture, which is deployed by the African National Congress. Now, what it means is that my beliefs and the beliefs of my party becomes one. I am a member of the African National Congress. And therefore, Honorable Klute, to answer your question specifically, I believe fully in the affirmative action. I believe fully in the PEE because those are the policies of the African National Congress. Thank you very much.
Thank you, Honorable DM. The third supplementary question is from Honorable Bacha. Honorable Bacha.
Mtanaka Bongwa.
Honorable Bacha.
Focus on the follow-up.
Bacha, don't do that.
DM,
Honorable Bacha, we are protected.
Thank you so much. Thank you, Ngosi Sihlalo Ndiyabulele. DM, I hear your response, but also we might say all the pretty things and trying to be as good as we can be because of the offices that we occupy. But I think that mainly what transpired in the town or area in question was more to talk about the outbursts proposing violence and arson and all the people that were there, which is not in good. It's not a good build up to the social cohesion that we talk about as a country. Now, nation building becomes the key and central to building a better South Africa. I think that's something that we agree upon, all of us. Now, my question is, what interventions will your government put in place to address divisive projects and work for all South Africans? Thank you, Chairperson.
Thank you, Honorable Bacha. Honorable DM.
Thank you very much, Honorable House Chair. And thank you very much, Honorable Bacha, for the question. First of all, I want to acknowledge what Honorable Bacha says, that social cohesion is critical for a better South Africa. And I think all of us, we agree, and all of us, we are in agreement. And all of us, we sit here wherever we are, striving to make sure that we participate in making a better South Africa. Now, divisive jobs, divisive programs is going to be a responsibility of everybody, because government on its own can put all systems in place to make sure that we do what we can in terms of making sure that we are able to meet what South Africans are expecting in terms of social cohesion. But as I have said in the first place, it becomes a responsibility of all of us as citizens of South Africa to understand and actually know what role we must play in making sure that this better South Africa is achieved. So we are not, the government in all of its programs, in all of its policies, doesn't have any policy that deals with divisive jobs. The government of South Africa, led by the African National Congress, strive at all times to make sure that we deal with the issues of unity, even to the detriment of the people that believe in us, that sometimes feel that we should be actually dealing with the previously disadvantaged. But because we understand what is it that we want to achieve, we try and make sure that we accommodate everybody. So when it comes to divisiveness, African National Congress and its organizations and its government is not even close to dealing with issues of divisiveness, because we are not even having that in our policies. What is important is to make sure that political parties and individuals work with the African National Congress government in making sure that what we had put in place, you work with us. At this point in time, the issue of social cohesion looks like it is only a project of the government of the African National Congress, and everybody else must look and see if the ANC wins with this project or not. And then you are able to say ANC has failed, ANC did not do enough. What have you done to make sure that this project succeeds? Thank you very much.
Thank you, DM.
Yeah.
Thank you. The fourth, which is going to be the last order, members. The fourth, which is going to be the last question of the day to you, DM, is from Honorable Mokause. Honorable Mokause.
Thank you, House Chairperson. House Chairperson, it's so irritating today to listen to disrespectful descendants of white supremacists in our country quoting the Constitution, descendants of land thieves quoting the Constitution, forgetting what they have done few weeks ago in a small town called Senegal, and what their forefathers have done to us, stealing our lands. It is actually disrespectful to even give them a listening ear. Deputy Minister, social cohesion is not manna from heaven, and that will not fall from heaven, Deputy Minister. It must be a deliberate act by genuine parties, all committed towards building a common nation, which we do not have more than 25 years in this country. Deputy Minister, we're far from that as a country because your government failed to address the injustices imposed upon us by colonialism and apartheid criminals, whom we are made to listen today in this very same democratic parliament. Are you of the view that there can ever be social cohesion without justice? And without...
Certainly not while the EFF's involved.
And without recognition by whites beneficiaries of a bloody privilege bestowed upon them by apartheid criminals of their grandfathers and colonialism. That is our question to you. Can you close that by being honest from the ruling party and stop being a coward?
Chairperson, point of order.
Stop protecting white people.
Honorable
How
Mokause.
can the EFF give lessons on social cohesion?
Chairperson, point of order.
Let me take the point of order.
Mokause.
Chairperson, the honourable member referred to criminals in this parliament. I would just like to know if she can indicate who they are and then work from there.
I referred to criminals.
Must be the VBS looters.
Honorable Mokause, we are not recognized.
Criminals who are still sitting in parliament who
Honorable
stole our
Mokause, we are not recognized.
off the mic.
Honorable Mokause, we are not recognized. Honorable members, I've listened to the question, I've listened to the point of order. I will rely on Hansa to get the actual context of how the question was structured. But now let's allow the Honorable DM to respond to the question. Honorable DM.
Thank you very much, House Chair. And thank you very much, Honorable Mokause. Maybe let me start by responding to this question by quoting what the Deputy President said in this House yesterday when he was responding to a similar, not exactly the same question. Deputy President said, social cohesion hinges on minimization of economic inequalities. The hosting of cultural events and debates will not produce a cohesive society. That's what Deputy President said yesterday. And therefore, Comrade Mokause, when you talk about injustices of the past, we all agree. When you talk about what is it that needs to happen, one of the basic things that needs to happen is to make sure that South Africans in general, those that are coming from the previously disadvantaged, must be given the opportunity to be actually equal economically, because once you have economic equality, some of the areas that are becoming very touchy will be dealt with, because the real issue at this point in time is that these things of flare-up events come from frustrations of poverty, of inequality, which in many policies that you are trying as this government to deal with. Of course, we have not been able to deal with all of them, equally, because it's work in progress. But the important thing here is that it is needing everybody's cooperation. It is needing everybody's making sure that they are committed to the project of social cohesion. It is not going to happen. It is not going to be a manna in heaven for social cohesion to happen if it is only the previously disadvantaged that are committed to this project. It must be a commitment from all of us, including those that had benefited before, to make sure that they make resources available to actually bridge the gap between the have-nots and the haves. So yes, social cohesion is going to be a project, a long-term project, but it is also not going to assist us when we actually try and become a bit reactive on these issues. We need to find a way of making sure that we have a long-term process of becoming proactive without trying to provoke each other, and making sure that this project is a project of all South Africans. Thank you very much.
Thank you, Honorable GM. Other honorable members, honorable delegates, honorable delegates, I would like to thank the Deputy Minister for availing herself to take questions in the National Council of Provinces. I'd also like to thank our special delegates and all of you, honorable delegates. That concludes the business of the day. The House is adjourned. Thank you.
Thank you, Chairperson.
Can the EFF teach everyone about social cohesion?
Hola, GM, hola, GM. Yes.
Ubahabulisile namhlanje siyabonga.
Very fun.